I'm Mary, the executive director of Cuddle Party Inc., and I am here with my friend Shelly today, who is a therapist of trauma.
Hmm.
And she is here to help you as a facilitator learn how to support your participants that might be showing up with trauma responses that are asking for help. So I'm really excited to talk to you about this, Shelly, today. So I'm really happy
Yeah.
that you're with us. Can you introduce
Nice.
yourself for us?
Yeah, sure. My name is Shelley Peer. I'm a licensed clinical social worker. I work out of Illinois. I own my own practice. It's called New Path Therapy and Trauma Consulting. So my kind of wheelhouse is trauma, specifically sexual violence and domestic violence, but any and all kinds of trauma. Um, I'm also an expert witness here for the courts on cases of child sexual abuse. I love doing presentations because one of my biggest things is making sure people are trauma informed, specifically those that are in care of others. So I'm excited to be here to talk to you about this topic today.
Yeah, we definitely want to be more trauma informed because I know people are just showing up with a lot more heavy stuff these days. Like
Yeah.
everybody, right? Everywhere.
Everybody, I mean, seriously, like the way the
Hmm.
world is right now, like
Yeah.
somebody is having some kind of trauma in some
Hmm.
respects. Yes.
Yeah, we all
Yes,
are
it's happening. We're
carrying,
all experiencing it.
yeah, we're all carrying a lot more than we used to.
Yep.
Can I ask you to adjust your screen just a little bit? Because you're kind of up
Oh,
like that. So
oh,
maybe just
like
a little,
this
yeah,
way?
just a little more centered.
Here we go.
Just so your
How's that?
head in it right up in the top. That's better. Yeah.
Okay. Yeah.
All right. Thanks.
Yeah, of course.
Yeah, and I know you have an outline that you like to give for intro to folks. Yeah,
Yeah.
let's just jump right in.
Yeah, so it's a good segue from everybody is experiencing trauma to let's kind of look at like what trauma means. Because
Yeah.
trauma is there's oftentimes been two categories of trauma. So we think of the big T trauma and the little t trauma. So the big T traumas are like domestic violence, sexual violence, people who have been a victim of crime, veterans. So
Mhm.
those kind of big, horrible situations are typically what people think of when it comes to trauma. Little t traumas are things that don't necessarily fit the criteria, the diagnostic criteria to then give the person like a PTSD diagnosis. So things like
Mhm.
job loss or a bad breakup or chronic stress, which everybody seems to be having right now.
Mhm.
Right? So kind of a good analogy is for big T trauma, an example might be someone who lost a child. A little T trauma might be someone who lost a pet.
Right.
And my kind of soapbox is I feel that it's unhelpful to categorize trauma in this way because both types of trauma act on the autonomic nervous system the exact same way. So whether someone has been beaten by their spouse or whether someone lost their job and has been unemployed for an
Mhm.
extended period of time, they're feeling the effects of the trauma the same way internally in their body.
Yeah, and
So,
I
yeah.
definitely know people like if they lost a pet, it is on the same level as losing a
Oh
child
my
for them.
gosh.
Yeah.
Absolutely.
Yeah.
Absolutely.
Hmm.
Yeah. So labeling traumas as little t traumas, I feel invalidates how people experience their trauma.
Right.
And it can often keep people from seeking help because, well, my trauma is not bad enough, right? Which is
Hmm.
ironic because I hear that from people who have big T traumas as well.
Hmm.
Like
Yeah.
nobody thinks they're like, and it's true. You can always look at people who have it
Hmm.
worse, but it's unhelpful and invalidating to trauma and how people experience their trauma because
Hmm.
little t traumas can be just as life changing and
Hmm.
harmful as big T traumas. So it's important
Absolutely.
to keep that in mind when working with people.
I agree. And I saw like a reel, whatever, from a podcast where they were talking about this of like, well,
Mm-hmm.
something that's considered trauma today wasn't trauma 100 years ago. It's like, all of that is irrelevant. If somebody
Yeah.
felt it as trauma, it doesn't matter what it is,
Yes.
right? Yeah.
Exactly.
Okay.
Exactly.
Yeah.
Absolutely. So it's important to keep that in mind because sometimes people
Mhm.
have biases
Right.
of, they hear someone who's talking about something that's affecting them, and it's easy to be like, that's not a big deal, right?
Yeah.
But if someone is experiencing discomfort based on
Hmm.
something that has happened for them, that discomfort doesn't discriminate if it's a big T trauma or a little t trauma. So,
Right.
invalidating people's experiences further increases trauma. So, a perfect
Mm.
example, kind of what you alluded to, my very first cat, I was very, very, very close with her. She was my soul cat. And when she
Mm.
passed away
Hmm.
unexpectedly, I couldn't go to work for 3 days. I was absolutely grief stricken to the point where
Mm.
I could not function. Now, if someone
Yeah.
had come in and been like, "What's your problem? It's just a cat."
Yeah.
Like now I'm healing from the grief of losing my cat and I'm healing from the invalidation of my relationship to that cat, right?
Right.
And that's a
Hmm.
common thing for people to be like, "Oh, well, it was just a fender bender, like no one got hurt." But depending on people's mental health history,
Hmm.
stability in childhood, stability in adult life, people may be more prone to normal everyday stressors that someone may just be like, going on about my day. It may affect them to the point of having trauma responses.
Absolutely. And
So,
I also feel like we're all just in such a more heightened state. It's like in this state
yes,
that any little trigger could just put us over the edge, right? I think that's happening more, right?
absolutely. Oh,
Yeah.
for sure.
Okay.
For
Yeah.
sure. And it was definitely like, for instance, COVID. COVID was a big
Mm-hmm.
trauma for a lot of people.
Right.
But because people still had to work, figure out how to educate their children
Mm-hmm.
who are now virtual and at home while they're working from home, and loved ones getting sick, loved ones passing away, the uncertainty
Yeah.
of what COVID was, right?
Mm-hmm.
So all of this stress, but you still had to keep going, right? And
Mm-hmm.
so what we saw is after COVID, I mean, COVID's obviously still a thing, but it's no longer the pandemic that it was now that we have some treatments.
Mm-hmm.
Afterwards, people started to crumble and they've been holding all of this stress to get through. And now that things have kind of, whew, okay, I can go back to work, kids are back in school. Now the trauma starts to come out. And that tends to be
Mm.
really common when people feel safer. They're more
Right.
likely to express that trauma to others.
Mm-hmm. And I think that is what happens in some of our events, especially
Yeah.
in this like in Cuddle Party where we're trying to create a safer space and have that
Mm-hmm.
room to have like the emotional release. And so
Yes.
I think that's exactly what happens, right?
Absolutely. Absolutely.
Yeah.
That's why creating that safety
Hmm.
of, before the group gets there and from the cuddle party practitioner themselves, like creating this as a safe space is
Hmm.
so important because then it allows not just emotional, but verbal, mental, physical, somatic releases of some of this trauma, which can be healing if treated in a proper way, right?
That's what we're going for. Yeah.
Yeah.
Other and facilitators of other group events too. I just want to help everyone be
Mm.
ready for this and like be
Yeah.
equipped to
Yeah.
handle it if they want to, right? As a facilitator.
Exactly.
So yeah.
Exactly. Yeah.
Oh, thanks.
So kind of, moving from that, I want to kind of talk about what the word triggered means because
Yes.
we use the term triggered a lot in our society, and it's kind
Mhm.
of been usurped by social media that everything is triggering, right?
Yeah, it's
And
overused
so
in my opinion.
it is overused because it then invalidates or devalues someone who truly is experiencing a traumatic triggering event, right?
Mhm.
So, what do we mean when we say triggered? So, triggered has to do with when the brain releases chemicals that triggers the autonomic nervous system, which the autonomic nervous system is responsible for the fight, flight, freeze, fawn responses.
Mhm.
So these chemicals in the brain And this is what a lot of people have trouble, let's say, a child passed away 5 years ago. It's been, gosh, 15 years since my cat passed away. Like, and then all of a sudden you're triggered, like for real,
Mhm.
because the brain can't necessarily distinguish that time has passed in that way. So if
Mhm.
something is still unprocessed or unhealed from that event, and something in the present triggers that memory, really it's triggering the brain to be like, we're in danger, we're not safe. And that
Mhm.
can be emotionally or physically, not just physically.
Right.
So, right, and so it releases those same chemicals as when the event happens. So the body's literally experiencing the same type of trauma reaction. And that's different for all people, right?
Mhm.
So each
Each
person's
person's.
kind of symptoms of trauma or being triggered will look different. So
But it,
irritability or, oh, go ahead.
I was gonna say, I was gonna ask, but it kind of throws you right back into where you were when you're actually in the
Yeah,
first instance of the trauma, right?
absolutely.
And
Absolutely.
that's like the clinical definition of being triggered.
Correct.
Okay,
Correct.
cool.
Yeah.
Yeah.
So for some people, if they're triggered, they may feel irritable. Some people feel anxious. Some
Mhm.
people feel depressed. Some people want to, and this kind of goes along with the fawn response of people pleasing, to keep everyone in their environment in a good state of mind, more than likely because they are used to growing up or living in an environment where people are hostile in a verbal or
Mhm.
emotional way. So, keeping everybody happy, right? Isolating, dissociation, issues in relationships, issues at school or at work, negative coping habits. So, oftentimes when people are triggered, they're more likely to abuse substances or feel suicidal, harm themselves, that kind of thing. There may be intimacy issues, hypervigilance, somatic feelings. So the body feels all of the feels just as much as our brain does, right? So
Mhm.
physical manifestations, IBS, for instance, is a common one.
Mhm.
Headaches and migraines are a common one. And then negative cognition. So remembering things perhaps that people have said in the past that now have become your own thoughts, like, I'm
Mhm.
stupid, nobody likes me, I'm
Mhm.
horrible at my job, things that are not actually true, right? So trauma can
Mhm.
often trigger some of those self-worth type thoughts to start
Mhm.
rumination. And there's so many more symptoms. Again, everybody is different. So how it
Mhm.
manifests in a group that's happening is going to depend on that particular person. Some people maybe withdraw. Other people start to get real anxious and real fidgety. Other people may cry. That's kind of like everyone's like, well, if someone's traumatized, they should be crying, right? Not necessarily.
Yeah, not
That
necessarily.
is actually not true. One of my
Mhm.
favorite kind of examples of this is if you've ever been to a funeral, right? So if you've been to a funeral, there are
Mhm.
people who are crying, of course.
Mhm.
Then there's people who are very stoic and have what we call a flat affect. There's no emotion showing on their
Mhm.
face. They're just kind of keeping it together, right?
Yeah.
Then there's other people who are like laughing and joking around.
Mhm.
And I mean, a good example of why this happens is I had a survivor once, which I used to work at a rape crisis center, and we would go to the hospital when a person would present after having been sexually assaulted and support them through the process.
Mhm.
So, had this client who was just assaulted, and she was hilarious. She
Mhm.
was cracking us all up. The nurses are cracking up. And at one point, she said to me, "If I don't keep laughing, I'm afraid I'm going to start crying and never stop."
Mhm.
So how people handle their trauma, right, is not
Mhm.
for us to judge. And it's also
Right.
not for us to say, well, if she's laughing and joking, clearly nothing happened to her. That is false, very false.
Mhm.
So, understanding that trauma manifests for people in different ways, emotionally, mentally,
Mhm.
physically, verbally, etc., is super, super important because a lot of people have this idea stuck in their head that true trauma means you're falling apart, right? You can't deal
Mhm.
with life, you're crying all the time, and that's just simply not true
Right.
because our culture is one of like do go to work,
Hmm.
work, you got to take care of your family, like,
Hmm.
and it doesn't allow for expression of trauma in a healing way, which is oftentimes why people have trauma that's long standing, because
Hmm.
maybe something happened 15 years ago and they haven't gotten the help that they need to work through it, right?
Right. Absolutely. So being in a triggered state, like how long can this be sustained? Like what is, I mean, I know
Good
there's not,
question.
there's probably not like a normal, but like
Right.
the way that you're talking, it sounds like it could be sustained for days or weeks even, but I was thinking of it like maybe an hour or two.
Both, both.
Yeah.
So it
Okay.
again, it depends on the
Could
person.
be.
I had a client today who
Hmm.
is having kind of a flare up of her anxiety, and it started last week. And
Mm.
so, the trigger, and she's also, I work with a lot of other like practitioners as well. So she was
Hmm.
triggered by a client and then has just until our session today, right, has been feeling
Hmm.
anxious for about a week.
Wow. Hmm.
And so it depends. I mean, for some people,
Yeah.
it may be a couple minutes. For other people,
Hmm.
it may be a more extended. The more extended it is, the more kind of like flashing red lights that your mind and body are like, please get help for this, right?
Yeah.
Please talk to someone. Please get help. There is
Hmm.
help out there, obviously, for trauma. And
Yeah.
if it's affecting someone to the point where they're having trouble completing their daily tasks or enjoying life. I mean, we think of a lot of
Hmm.
times victims of traumatic events, right? And we
Hmm.
want to turn them into survivors. We also, though, want to go a step further and help people thrive. Because if you think about it, surviving really isn't living. Like you're just white knuckling it, right?
Right.
Through the day.
Exactly.
So
Yeah.
we want people to thrive. So if they're experiencing like long standing trauma responses, it might be time suggesting, and obviously, people when they're ready to get help, they will, can't force anybody.
Yeah.
But planting that seed of, have you thought about talking to someone who specializes in this?
Hmm.
Because some people, again, especially if they don't think that their trauma is a big deal or it's not bad enough,
Hmm.
and also for, I would say, certain populations. So men have a real difficult time feeling safe
Hmm.
enough to like come to therapy or talk to somebody.
Yeah.
And others too, other certain cultures or religious groups, that's not a thing. That's you don't talk about your
Hmm.
trauma. You don't talk about, it's interesting.
Yeah.
So I come from my family's Polish, both sides. And
Hmm.
so if you're feeling depressed when I was growing up, if you're feeling anxious, you're not cleaning enough. Get a broom and start sweeping, you won't feel anxious anymore.
Then you'll be
And
fine.
thinking about that, that's ridiculous. But if you think about what, for instance, the Polish people have gone through being the doormat of Europe for so long,
Mhm.
like they didn't have time to talk about their feelings because they lost half their family to the Nazis and have to like continue to live and raise their kids or find
Right.
safety or whatever, right?
Still
So,
gotta get up in the
yeah,
morning.
still have to get up in the morning. Exactly.
Hmm.
So certain cultural groups have just kind of, we don't talk about these things. We sweep it under the rug and we keep going. Which, I
Mm.
mean, generational trauma is a whole big thing. That's for a more
Mhm.
advanced presentation, but
It exists.
but it
Yeah, for
exists
sure.
because of these things, right?
Yeah.
Yeah.
And I
Yeah.
really like what you said, so I kind of want to call it out because it feels like a tool for our facilitators. Because you said if you witness somebody who's maybe having
Hmm.
what looks like a trauma response, um,
Hmm.
you can say, "Have you thought about talking to someone who specializes in this?" Instead of saying, "You
Yes.
need
You
therapy."
need
Like,
to. Oh,
yeah.
yes.
So
Yes. I
that
mean,
doesn't come
that's,
across. But like,
yeah.
have you thought about talking about somebody who can help you with this kind of thing? Because they've helped other people who've had
Yeah.
that, right? That's a better
Exactly.
approach. Yeah. Okay.
So much better. And I mean, that is kind of a way a lot of people, especially friends and family, may be like, you need to right now call a therapist right now. I sent you some
Mhm.
options. Like,
Yeah.
these kinds of things. And
Hmm.
it really puts a lot of pressure on the person. And
Yeah.
it is true, not everyone who experiences trauma needs to see a therapist,
Yeah.
but there are reasons why people may be more likely to be more affected. Again, childhood issues, mental health issues in general, stress in their life, which is now making these traumas kind of come to the surface. So there's all sorts of issues that will can lead someone to pursue therapy, but they have to be ready for it. As a therapist, one of the big
Mhm.
things, and this is true for anyone in any helping profession, you can't work harder than the person that you're trying to help. So if someone is not ready to do the
Hmm.
work, because let me tell you, trauma therapy isn't rainbows and kittens. It isn't fun, right?
Yeah.
But the whole point is to get that person to a decreased level of distress, right? So they're not
Right.
experiencing those same feelings that are
Hmm.
disrupting their life. So
Yeah.
recognizing that as the practitioners that you all are, you have that unique
Hmm.
ability to plant the seed, right?
Yeah.
And oftentimes people will be like, well, that's not doing anything. They're not getting any help that way. Actually, you are. So you're that
Hmm.
first link in the chain. Maybe this person has never
Hmm.
thought about like getting help for this issue.
Hmm.
So, planting that seed, being that first link in the chain will then start them on the road to now maybe contemplating and eventually getting help for whatever it is. So don't
Hmm.
think you're not doing anything by kindly suggesting, hey, have you thought about this? And I mean, probably the first thing I would ask is, do you have someone outside of here to talk to about this? Because then they may say, yeah, I have a therapist. Okay, perfect.
Yeah.
Great. Can you contact
Yeah.
that person after the group is done, right?
Right.
But
Yeah.
if someone's like, no, I really don't, then
Hmm.
you can, have you thought about maybe
Hmm.
finding yourself someone who specializes in this area?
Yeah, and
Yeah.
and I think that I like that too because I think just saying a therapist or getting therapy can feel a
Mm-hmm.
little daunting to people sometimes. But
Mm-hmm.
really what you're a specialist that helps people with these things.
Correct.
Exactly.
Correct.
Right?
I am
That
a trauma specialist.
yeah.
Exactly.
Yeah.
Exactly.
And it
Yeah.
and it's not about like fixing them. It's about
No.
helping them, right?
Right.
And like what you
Exactly.
said, like they have to be ready to receive the help and do the
Yes.
work. And if they're not, there's
Yes.
no point, right?
Exactly. I mean, there's nothing more frustrating than trying to be a therapist with someone who doesn't want to engage in the process. Like,
Yeah. Yeah.
it's a waste of time for everybody.
Right.
But, when someone is ready and
Hmm.
they're, ready to take advantage of any resources out there, which, I can give you a list of resources to help people kind of,
Yes.
find what they need. So, yeah, so being able to kind of gently suggest
Hmm.
that without any attachment to the
Hmm.
outcome. And I think
Right.
that's a big thing because especially
Hmm.
people who are in the helping profession, which you guys
Hmm.
are, right?
Yeah.
You want to
Yeah.
help. You want people to feel better, right?
Right.
Which is great. Just
Yeah.
doing what you're doing is helping, right?
Yeah.
So, but for people who have some more severe type issues like
Hmm.
trauma that is affecting them, it's not going to be magically waved away in one cuddle party. Like,
Right.
I
No,
wish you guys had that kind of power,
I
but
wish. I mean, a hug will go a long way with a lot of people, but
right, right.
yeah.
Yeah, yeah.
We'll keep
Yeah.
trying.
Keep trying, keep trying.
Yeah.
So
What's
next I kind of
next?
want to talk about like as a cuddle group leader, facilitator,
Mhm.
what would be helpful qualities to have to help people who are experiencing trauma. So there's five main call them tools of effective helping relationships.
Oh, excellent. Yes, please.
Yeah. So the first one, which I'm sure you guys, and you can correct me if I'm wrong, is
Mhm.
rapport building. So I'm sure
Mhm.
you all kind of talk about, again, creating a safe environment and
Mhm.
building rapport quickly so as to invite people to be more vulnerable in these groups, right? How
Mhm.
much do you all talk about that?
Um, well, so let me just give you a little. a little overview real quick
Yeah.
because we have two trainings. One is specifically for Cuddle Party, and the
Hmm.
prerequisite to that is for any group facilitator.
Oh, nice.
So yes, in the Cuddle Party setting, we have a welcome circle script where we do go through like, here's
Good.
our agreements. And we're
Good.
doing this because we want to be safer with each other. We want to set
Yeah.
up our expectations and our
Yep.
agreements right ahead and know what we're getting into and know how we're going to
Yeah.
communicate with each other and by doing that create a safer place for
Yes.
us and a supportive
Yeah.
space.
Yeah.
And for our people that are not necessarily doing cuddle parties,
Hmm.
we do recommend what's figure out what your container is. What are your expectations? Like
Yeah.
Cuddle Party has this script that we follow.
Hmm. Sure.
What's yours? What are the expectations that you're telling your
Yeah.
people? What are the things that you're doing that sets up
Yeah.
the safer space for them? If that's
Good.
what you want to do, we hope so.
Right.
Yeah,
Right.
yeah. So we talk about that, like how
Perfect.
do we show up with integrity as the leader of
Yeah.
the facilitator of the group, and
Yeah.
think about our own power dynamics and
Hmm.
inclusion, and there's so many factors. There's
Perfect.
just so many factors.
Yeah. There
But yeah,
really is.
setting up the rapport is like
Yeah.
making sure people have the information ahead of time of what's going to happen. And then when they
Yes.
get there, we set the container, with
Good.
consistent with what we told them.
Yeah.
And then we have
Yeah.
the event, and then we have a closing, some kind of closing to process. And then
Perfect.
depending on what type of facilitator they want to be, if they're going to be
Hmm.
available to work with their people outside of events or if they're going to hold
Sure.
multiple events.
Sure.
Yeah, we talk about that. So
Good.
yeah.
Perfect. That is beautiful. Yes.
Yay.
Yay. Yeah, I mean, it really is. It's a skill to be
Hmm.
able to build rapport fast because with cuddle parties, the facilitator may not necessarily have a deep knowledge of every single person who is attending, right? So
Right,
how do you
right.
hook those people in, make
Hmm.
them feel safe enough
Hmm.
to open up and truly participate in the
Hmm.
process, right? And so everything that you just described, love it. Love it, love it.
Yay.
You are doing it. So can
Nice.
check that off.
Check
That's good.
that off. Yeah, and
Check
I
that off.
always do
Yes.
introductions with everybody, so everyone can be introduced to
Yes.
everyone.
Good.
And
Good,
in the events
good.
that I hold, cuddle parties or otherwise,
Hmm.
as we're setting the container, it's a group experience. It's not
Oh,
just
I love it.
let me just tell you the rules. It's like, here's what I'd like to agree to. What do you guys think about that? Do you have an experience? So we all
Yes.
get a chance to like talk with each other and hear
Oh,
from
that's
each other
great.
to see and be seen. And I feel like that
Yes.
is part of the rapport. And I always try really hard to use
Yes.
people's names as a facilitator.
That's
So
and that's a good one, especially for those of us
mhm.
who have memory issues. But
Yes.
that is good. That is using people's
Hmm.
names and
Hmm.
including everybody in that
Hmm.
opening,
Yeah.
kind of experience. Love that. Love that.
Hmm.
So that
Yeah.
is you've got that one down. So that's good. So then the next tool, which you would think would be readily available in people who want to be helping others, but not necessarily so. So the next tool is empathy. Now,
Oh,
empathy
yes.
is different than sympathy, right?
Hmm.
People need like kind of a quick crash course, Brene Brown, who is like one of
Hmm.
the best ever, has a great video. It's a little cartoon explaining the difference between empathy and sympathy.
I've seen it. Yep.
Yeah. So basically,
Hmm.
empathy is an awareness of other people's feelings.
Hmm.
So, one of the things that you should never, ever, ever say to a trauma survivor, if they have, kind of talked about what's going on with them, is
Hmm.
never say, I know how you feel.
Hmm.
That's a big no-no. And a lot of people want to show empathic engagement by saying, "Oh, I've been there. When this happened to me, blah blah blah." Nope, nope, nope. First of all, you just took attention away from their trauma.
Right.
And
Yeah.
secondly, you may have gone through very similar, almost exact. You still aren't going to feel the same way that they do because everybody experiences things differently. So never say, I know how you feel.
Hmm.
Even if you are pretty sure, right? I always
Yeah.
like to ask, how are you
Hmm.
feeling right now?
Yeah.
So now we're bringing it back into the present, which as, the group, you all can then kind of take care of what is happening right now with this person.
Hmm.
And some people are like, it looks like you're feeling anxious. That's better than saying, I know how you feel, but you just put a feeling onto them that if they're people pleasing, they're going to say yes. Or they're going to be
Hmm.
like, no, actually, I'm feeling really ashamed or something like that,
Hmm.
right? So
Hmm.
asking, how are you
How
feeling
are you
right
feeling?
now?
Yeah.
Right? Where do you feel that in your body? And the
I
biggest
love
thing,
that
what
one.
do you need right now?
Hmm.
So some people
Yeah.
may just need to like, don't call on me for the next 15 minutes or like I'm going to
Hmm.
go and sit over here, right? Some
Hmm.
people may need to like get up and have a moment alone or get a drink of water or whatever. So whatever
Hmm.
y'all can do to support what that person needs in that moment. And
Hmm.
if they're really struggling, then that might be a time. And I remember talking to Keely about this, that she likes to have a second practitioner for these kinds of situations because you
Hmm.
don't want to, it's a hard balance if you're a group practitioner and you're the only one and you have someone crying in your bathroom and the rest of the group is sitting here like
Yeah.
right?
Like,
Like
what do you
you
do?
have to be
Yeah.
able to handle both, and that
Hmm.
may be too much. That may be too much for a professional. Like, so
Yeah.
having someone who, or maybe you have someone who is a regular at your cuddle parties, and
Hmm.
it's okay if they miss the next group and if they feel comfortable. Do you feel
Hmm.
comfortable going to check on Cecily?
Hmm.
She's, it seems like she's struggling while I finish
Yeah.
up with this, right? And then
Hmm.
take a break and then you go and check.
Yeah.
So managing, just kind of noticing, managing
Hmm.
kind of how group dynamics like that. And then also, again, with the empathy, understanding it, being aware that someone may be struggling, as opposed to this person is
Hmm.
struggling, moving on, I've got shit to do. Like, I've got a whole outline of stuff. I got
Hmm.
to get this done. Like, this is a prime moment
Hmm.
to, have this person feel what they're feeling in their body. Again,
Hmm.
being able to ask for what they need. A lot of trauma survivors don't feel like they can ask for what they need. And
Hmm.
so being able to have the space to do that. And maybe someone, and this
Yeah.
happens a lot, what do you need? I don't know. That's
Hmm.
okay. Right.
Hmm.
So, here in a little bit, I've got some kind of examples of what might be some
Hmm.
good grounding exercises or things to suggest to kind of help in those moments. So, we'll get to
That's
that.
good. Yeah, I do want to talk about that, but you are bringing up something else for me that I'm thinking of since we are trying to support kind of all types of facilitators.
Yeah,
It could be a valid choice that we are not going to offer help to them. Right?
absolutely.
I mean, what would be the danger of that, do you think, with somebody who's having
Absolutely.
yeah.
If you don't feel comfortable or if you don't feel like you know enough to know how
Mm-hmm.
to support this person right now,
Mm-hmm.
I'd rather you not. And
Thank you.
say it. Like, don't
Yeah.
just ignore the person, right?
Right.
But say, and this is true for professionals too. For
Mm-hmm.
instance, if I get a client that is like, hey, I'm struggling with anorexia, I'm going to say something along the lines of, I'm so sorry that you're struggling with that. That is not something that I know a lot about how to treat, and I want you to get the best care possible. And it ain't
Mm-hmm.
me, right?
Right.
So then helping with like, who can you call right now? Or,
Mm-hmm.
again, do you have someone to talk to outside of here, right? And then maybe
Yeah.
kind of starting to build that chain for maybe they do need a therapist.
Mm-hmm.
But I would rather someone do
Mm-hmm.
that than try and help and mess things up more,
Yeah.
right? Say the
Like
wrong thing, do the wrong thing, and
yeah.
now you've just created an unsafe space for this person.
Right. And that is a choice a facilitator can make of like,
Hmm.
I this is not something I choose to
Hmm.
offer with my, my bandwidth or my emotions or
Absolutely.
my toolbox of my skills, I just don't
Yeah.
have that skill.
Yeah.
And then your choice is like you could find an assistant or a co-facilitator that would manage those things with you.
Hmm. Hmm.
Or you could say, oh my gosh, I know Cecily's in the bathroom crying and we do need to move on with this because this is
Right.
what we're doing here. And
Right.
As long as
right.
it's an intentional choice, right? I think it's okay to make that,
Exactly.
right?
Absolutely.
Yeah.
Absolutely. Yeah, because you're right. Not
Yeah.
everyone is going to have a co-facilitator or someone they feel can, handle those kinds of
Hmm.
situations. And you
Yeah.
do have to like go through your event. You are hosting the event,
Yeah,
right?
depending on what type of event it is, maybe it is timed and you really do need to keep going, and that's okay.
Right. And that's okay. Exactly,
Yeah,
exactly.
we
And
didn't sign. Yeah. So
yeah,
I want to make
yeah,
sure to leave space for that too. I mean, I do feel
absolutely.
like it is best practice to be prepared for these
Hmm.
kind of things. That's why we're doing this right now.
Hmm. Yeah, yeah,
And I
exactly.
also feel, again, like it's a valid choice if there's a facilitator who chooses that they're not going to do that.
Absolutely. And we'll get to this a little bit later too. But if thinking that, okay, I can totally help this person and like support this person, but
Mhm.
it's going to trigger my own stuff, that's another reason to again
Mhm.
be honest and be like, I want you to get the best care possible. I can't do it right now because of
Mhm.
whatever. I have to continue with the group, or
Yep.
I'm not prepared to handle, and you need someone who knows what they're doing or whatever,
Mhm.
right?
Yeah.
But yeah, don't get into trauma stuff if it's going to trigger yourself,
Mhm.
because that's not good either, because you have a group to finish, right?
Right. Yeah. And that actually, I'm like, you're looking at me, Shelley. Like I feel like I can offer support, but
Yeah.
it really drains me and it really activates me too.
Yeah.
I don't like
Oh,
to say trigger for
yes.
myself. I like to say activated because I do. I get
Activated.
anxious and
Yeah.
I'm a lot in a much heightened state when I help
Yeah.
people manage a trauma trigger response. And I know
Yeah.
that in myself and
Yep.
I prefer not to.
Yeah. Oh, for
I feel
sure.
like I
For
can
sure.
manage
Yeah.
it, but I don't. It's very
Yeah.
unpleasant for me and it takes a lot of energy. So,
It's true.
so
And actually,
yeah.
you just hit on a really good point, which again, I always say this when I do presentations. We're going to get to this later, but since you brought it up now,
Mhm.
if working with someone or talking to someone who's having a trauma response is going to escalate you to
Mhm.
anxiety, or, just being un what's the word that I'm looking for? Not centered, right, within yourself.
Yeah.
If that's going to cause you to get kind of off-centered and anxious or what
Mhm.
have you, it's best to not, because then your anxiety is going to cause them to raise in activation, right?
Oh, thank
So
you. Yeah, I hadn't thought of that.
being able
Hmm.
to remain calm so that it
Hmm.
brings them to a state of calm. Not
Hmm.
everyone can do that, and that's okay, right?
Right.
So
Yeah.
recognizing that within yourself, if,
Hmm.
your presence is not going to be helpful, probably shouldn't do it.
Probably just don't. Yeah.
Yeah, just don't. Just, yeah, yeah, exactly.
Thank you.
Yeah, absolutely. So then the third tool of a
Hmm.
healthy, caring facilitator, which so far I'm sure is not a problem for you guys, is caring and warmth. So
Hmm.
the
Hmm.
ability to show concern, right? You're not
Hmm.
just a robot
Hmm.
reciting things. Like, you
Right.
care about the people who are attending this cuddle party,
Hmm.
and you want them to experience and feel good and, enjoy
Hmm.
themselves and feel safe. And so, being that caring, warm person, my guess is the quality a lot of your facilitators have. But it's also, I mean,
Absolutely.
not
Yeah.
everybody has for just
Right.
general group leaders, right?
Right. Yeah.
Hmm.
Yeah.
So then the
Definitely.
fourth is kind of goes along with what we've been talking about. So the fourth tool is genuineness.
Mm.
So mean what you say what you mean. Don't
Yeah.
bullshit, don't lie, don't fake your
Hmm.
way through it. So if you
Hmm.
truly don't feel you can handle someone's trauma response, it's okay to say so in a caring, considerate
Hmm.
way, right?
Yeah.
As opposed to fumbling your way through, knowing you don't know what you're
Hmm.
doing, and
Hmm.
creating more problems for this person,
Yeah.
right?
So, so I might say something like, I'm coming to check on you and see what's going on. And if I realize
Mhm.
they're in a full trauma response, I might need to say, I can see that you're very activated right now, and this is not something that I have the skills to manage. Can I call somebody for you? Is there a request you
Yes.
have for me right now? And if they're not able to tell
Yes.
me anything, then I'll be just like, I'm just going to leave you here for a minute then, and
Yep.
I'll come check back on you later. Is that a good?
Exactly.
Okay.
Would you like something to drink? Um, do you need to, lay down somewhere? Do you
Mhm.
want a stuffed
Yeah.
animal to hug? So if they don't know what they need, it's okay to suggest some things that,
Okay.
maybe
Yeah.
quick things that you can hear. Here's some water. Okay, I gotta go finish whatever this is
Yeah.
the
Do you
group
want
is
to go
doing.
outside and get some fresh air,
Fresh
maybe?
air, that's a
Hmm.
great one. Yes,
Hmm.
exactly, exactly. Because really, I mean, part of what's happening with that person is they're thrown back to when the trauma happened, right? And even if
Hmm.
they're not like, I'm just feeling really anxious, but
Yeah.
their brain, their nervous system is like, warning, 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 right?
Yeah.
So
Hmm.
being able to help ground them in the here and now by drinking something or feeling the fresh air from outside or hugging something. Fidget toys are great too to help kind
Hmm.
of bring their mind back into the here and now. Um,
Right.
so anything to kind of be in the moment, to help them be in the
Hmm.
moment. And then can go off and do what you need to do for the
Hmm.
rest of the group, right?
Yeah. Yeah. Because we still have the
Yeah.
whole group to keep in mind.
Exactly.
So, yeah.
Exactly. Yeah. And it may be a thing that like, you take a quick break so people can go to the bathroom and get a
Mhm.
drink and, that's when you go and check on
That's
this
what you could check
person.
on them. Exactly. Yeah.
Right. So
Ooh,
you
well,
don't
now
have
I
to
need.
like stop your like,
Right.
yeah.
No, could just be a break.
Yeah.
Or you,
Yeah.
yeah, and we talk about this too of like you can give the group like some something to do in small groups, ask,
Yeah.
what do you think of it so far? Turn to your neighbor and talk to them, you know.
Yeah. Yeah,
Yeah.
absolutely.
Hmm.
Absolutely. Yeah,
Yeah.
exactly.
Hmm.
Exactly.
Yeah.
Mm.
Yeah.
Another good idea might be for people who are having a trauma response and maybe they do need to go sit off by themselves or whatever, and you go and check on them. I like to keep, when I was in person, I'm now virtual, but when I was in person and seeing clients, keep little journals. You can get them super cheap, and give them a pen or maybe some
Hmm.
crayons or something. And here, do you feel
Hmm.
like, drawing or writing or your feelings down, that kind of thing, so they can be doing something while
Yeah.
you're, continuing with the group as well.
Right. Exactly. Thank you.
Yeah, yeah.
Yeah.
And then the last tool, which is my favorite, is unconditional positive regard.
Uh,
And I feel like this is a good one that goes beyond trauma survivors. It's for anybody who's facilitating groups, anybody
mhm.
who's in the helping profession. So,
Mhm.
unconditional positive regard is the ability to accept, value, and care for an individual regardless of your own beliefs and values.
Mm.
And that
Mhm.
can be really hard.
Yeah.
Right? So being able
Yeah.
to see this person as a human being and
Yep.
treat them accordingly, even if you don't agree with some
Mhm.
aspect of who they are, whatever that
Mhm.
might be, right?
Right.
So right
Yeah.
now, there's a whole lot of like political beliefs that are
Mhm.
breaking people apart and
Mhm.
causing people to,
Mhm.
basically excommunicate others from their life. If
Mm.
you are
Mhm.
facilitating a group and someone expresses a political belief that is not in line with yours, that can be very difficult, but also in this space,
Mhm.
they are still a person,
They
right?
are a person.
They
Exactly.
are a person.
Yeah.
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 So, and
For sure.
that can be difficult. So, for instance, as
Mhm.
a therapist,
Mhm.
I am a member of the LGBT plus community, and
Mhm.
I have had clients who are like actively heterosexist.
Mhm.
Now, they may not know that I am gay. They
Mhm.
they wouldn't, because then they wouldn't be saying those things so freely. But, and most of my
Mhm.
clients know because it's on my profiles, but I have had clients in the past who come in who express some of these views.
Mhm.
And in that moment, when we're treating their trauma and they're like in the throes of distress, is not the time for a lesson on on being
Yeah.
accepting, right? Like,
Yeah.
we'll
Mm-hmm.
get to that eventually,
Mm-hmm.
but like I see their distress and that's what we need to address right now, not the fact
Right.
that they're racist or whatever,
Yeah.
right?
They're still a
So
person.
they're still a person.
Yeah,
And, and
exactly.
obviously, like, if someone is actively racist, especially if the practitioner is a person of color, that
Mm.
person may not be invited back in the future simply because
True.
it's just not a good dynamic and it's not going to
Hmm.
create safety for everybody, right? That's
Right.
fine. But in
Yeah.
that moment, while they are there in your group, treating them like a person, treating them with empathy, treating them with caring and warmth,
Hmm.
even if you disagree with some of the stuff that they're saying.
Yeah.
Yeah.
Well, even if we have to ask someone to leave, we can still be
Hmm.
respectful and not
Hmm.
like give them
Right.
vitriol, like
Exactly.
you're a horrible, maggot
Right.
or whatever.
Right.
We don't
Right.
have to go there. It's just like,
Get
this is
out.
just not
Yeah.
a good fit for you, right? This is not a good fit. And for the
Exactly.
safety of my community, and for
Yes.
and to meet your own needs, which are not being met here, you won't be
Yes.
welcome back, Yeah.
Exactly. And I think doing it in that kind way is a good model for
Mhm.
people because it's so easy to just start going and, you know,
Giving
the fuck
judgment
out
and
and
yeah.
like, yeah, like making a
Hmm.
whole big scene, as
Yeah.
opposed to it's okay to have disagreements. And I get
Hmm.
like some of the disagreements are like really extreme right now because people are not
Yeah, I get
being
that. And
good
there's
stewards to
still
other
people
humans.
too, though.
But they're still people, right? So while they're
Yeah,
in your
even when they're that
space,
extreme. Yeah.
right, like being able to show that like
Hmm.
this isn't going to work, but I'm
Hmm.
still going to be kind to you, right?
Yes, right. Because people don't
Yeah.
listen when we start heaping judgment on them,
Oh,
or that it
yeah.
just makes
Yeah.
people more angry and more violent if they're prone to that,
Yes.
and it
Defenses go
confirms
up and
their ideas,
yeah, exactly.
which we don't want to give them confirmation
Exactly.
of that.
Exactly. Exactly. Totally.
Yeah.
Totally.
I really like Speak Peace by Marshall Rosenberg, the nonviolent communication.
Ooh,
What do you think of
yes.
that? Yeah.
That is,
Okay.
I love that too. Yes. Yes.
Hmm.
Nonviolent
Okay.
communication. There's a couple of
Hmm.
books. There's the
Yeah.
main one, there's that one, there's a workbook as well. So
Yeah.
learning how to communicate nonviolently is a really
Hmm.
good skill, not just for this, but in everyday life, for regular
Yeah.
relationships too.
For this, what did you call it? Positive regard. For what was the first one you said?
Unconditional positive regard.
Unconditional positive regard. Being
Hmm.
able to speak with the language of nonviolent communication is
Yes.
just the way to do that, in my opinion.
Absolutely.
Yeah.
Absolutely.
Mhm.
Yeah. Yeah, for sure. For sure.
Yeah.
Yeah, so
Nice.
those are the five traits of helping professionals.
Why don't you line them out for us one more time, please?
Yeah, absolutely. So the first one is being able to build rapport
Right.
with your group. The second one is empathy. The
Hmm.
third one is caring or warmth. The fourth
Hmm.
one is genuineness. And then lastly, unconditional positive regard.
Excellent. Yeah, I love
Yeah.
that.
So if those
Thank you.
are qualities that you
Hmm.
have, you'll probably be a really good facilitator of groups.
Absolutely. Yeah, people will be
Yeah.
drawn to you for sure.
Yeah. Yeah. So the next, I kind of want to talk about how to, and this is part of rapport building, as well as taking on kind of if someone is having a trauma response, how to navigate that non-verbally and verbally, because both are equally important, right? So
Hmm.
I kind of
Excellent.
want to go through the non-verbals, and this is just going to be like a brief painting with broad brush strokes
Oh yeah.
here,
Yeah, this is
right?
an intro class, so yeah, absolutely.
Yes. So just, so some five kind of tips of how to
Hmm.
keep your nonverbals basically in check, right?
Hmm.
So the first one, facial expressions. So
Hmm.
some people don't know what's going on with their face
True.
when people tell them things, right?
Hmm.
So, and the examples I use are examples because I've seen them happen, right? So
Hmm.
number
Yeah.
one, don't roll your eyes.
Mm.
And you may not be doing it as a, oh my God, I can't believe this. This is like, right.
Yeah.
It may just be some people like kind of stretch their eyes or maybe have something in their eyes, but
Mm,
be cognizant of that because it can
hmm.
obviously appear as indifference or judgment.
Yeah. Or
Same,
even if you're just kind of like,
yeah,
that just shows
right.
like you're not in the moment, right?
In the moment, exactly.
Yeah.
You're not
Hmm.
connected with them, right?
Hmm.
Same with
Yeah.
disapproving looks. So this
Mm.
is for all of my friends who have what is known as resting bitch face, right?
Yep.
It's just the way their face is. So if you
Yeah,
are one of
this is
those
my
people,
face.
yeah, if you are one of those people and you know that that is how your face looks, right?
Hmm.
So trying to then make sure that you have a calm, relaxed face. Maybe
Hmm.
you're, looking at the person helps as
Yeah.
opposed to, looking elsewhere, looking at your phone. I've seen that too.
Mm.
So being connected with your eyes, obviously you don't want to stare them in the eyes because especially
Hmm.
culturally and for some people who are neurotypical or neurodegenerate. Oh my God,
Divergent.
neurodivergent.
Neurodivergent.
Thank you. Yes, neurodegenerative. What?
Yeah.
Okay,
Yeah. I know. Right?
neurodivergent. Like that's not an okay thing. Is
Hmm.
heavy eye contact, right? But looking
Yeah.
at the person as they're
Hmm.
speaking, right, or leaning in a little can
Hmm.
help offset what your what your face looks like, which sounds
Yeah.
hilarious,
And
but
if you're having a hard time looking in their eyes, you could look at their mouth, right?
exactly. Or
Okay.
just kind of
Yeah.
an overview of
Just
the person's
generally.
face. Yeah.
Yeah. Their
Or,
whole
yeah,
face.
exactly. Exactly.
Yeah.
So watching those kind of facial expressions. Along with that, the kind of the second nonverbal is smiling. So some
Mm.
people smile and laugh when they're nervous. That's just
Hmm.
how it is. But that can
Yeah.
communicate the wrong message if someone is having a
Hmm.
trauma response, right?
Yeah.
So just
Yeah. If it
something
comes
to
off as like
note.
smirking or something, it could be,
Right. Or
yeah.
invalidating that, this isn't really a
Hmm.
big deal when it is clearly a big
Or like,
deal because
why are
it's
you
pretty.
laughing at me too, right? Like, stop
Right.
laughing at me. Yeah.
Exactly.
Even though
Hmm.
you're not meaning it that way, it could just be, like you said, just
It's just
nervous
yeah, you're
response.
just nerves.
Yeah.
Exactly.
Hmm.
Exactly. So noticing that.
Hmm.
And then we kind of already talked about like engagement as far as showing that person that you are listening and paying attention and you care about what that person has to say. So that could
Hmm.
be, like I said, leaning in, having an more open body posture. So
Hmm.
this does not communicate a warm, caring that I care about
Hmm.
anything you have to say, right? So
Hmm.
not crossing your arms. Now, if people are, sitting on the floor or sitting with crossed legs, that's fine, right?
Hmm.
Nodding as a person is talking. So these cues that we have that shows like, okay, I'm here with you. I care about
Yeah.
what you're saying. I'm tuned in, right?
Hmm.
So, and then fourth, being relaxed. So we talked a
Hmm.
little bit about this earlier. If you don't feel like
Hmm.
you can do that with someone who is
Hmm.
having a trauma response, then it's best not to.
Hmm.
And I'm sure people have heard of the heart math study. Have you heard of this?
I think so, maybe. Well, tell me.
So yeah, so HeartMath is a organization based out of Chicago that studies neurobiology, physiological responses, all sorts of things. So they did a study once where they measured the EMF, which stands for electromagnetic frequency. They measured the EMF of all the different organs in our body. And we are energy, our organs give off
Hmm.
energy, right? So they're
Yeah.
measuring these different organs. And what they found out is the heart, their EMF field that's coming off the heart can be felt 6 feet in a circle around us.
Wow.
What that means is, and people, I'm sure, like, someone just, walked into the room and I immediately could tell something was wrong, right?
Mm.
So, nonverbals and the energy that our body is giving off, we pick up on. So, we can then influence or we can be influenced by other
Mm.
people's energy. So, why this is important if you're facilitating a group
Hmm.
and you have someone who is activating for you, and this could be someone who is having a trauma response, this could be someone who just those people they just kind of like to push the envelope and like question things and like
Drama.
yeah, Exactly.
Drama queen. Yeah.
Drama queens. Yes.
Hmm.
So it's easy then to feel yourself getting activated right along with these people, right?
Hmm.
The trick to countering that is to make sure you are remaining grounded and calm. And if you feel yourself starting to escalate,
Hmm.
doing something, maybe taking a sip of your beverage or taking a deep breath, something to kind of recenter yourself. Because
Hmm.
if you are calm, inevitably it will bring these other people's activation down, right?
Hmm.
And that's the whole point, right? If you are activated, it's going to activate them. Their
Yeah.
energy is trying to
Feeds on
activate
each other.
you. So,
Yeah.
and it takes practice. Not every again, not everyone has the skill to be able to be
Hmm.
calm in activating situations.
Hmm.
And it may also make I'm really good at it, but there are some days I'm not going to be because I've read too much news or like
Hmm.
something
Yeah.
has happened in my personal life that I'm just a
Hmm.
little bit more activated than usual, right? And
Hmm.
that's okay.
Yeah.
Knowing what you need to be
Hmm.
okay. Maybe it's not to engage with this person right this second. Maybe it's just to say like, I can tell you're really struggling. Like, do you want to take a second by yourself? Or what do you need? And what do you need right now is
Hmm.
always a good thing, right?
Yeah.
Yeah. Yeah.
Hmm.
So yeah, and then lastly, for someone who is having a trauma response, non-intimidating body posture and touching. This is where the whole concept of consent is so, so, so important because some people will want, a pat on the back, a hug,
Hmm.
right? Other people
Hmm.
do not want to be touched at all because it is going to make things worse, right?
Hmm.
So
Yeah.
asking before engaging in
Mhm.
any kind of contact and also, like, if you are, let's say, standing over a person who is having a trauma
Mhm.
response, very intimidating,
Yeah.
very activating, right?
Yeah.
So, if they're sitting, sit. If
Hmm.
they're, sprawled out on a couch, kind of
Hmm.
kneel next to them, get to their level
Hmm.
so that you're imposing my 5 foot imposing structure is not going to intimidate someone, right?
Right.
But you
Yeah, and
get
I
what
like
I'm
what,
saying.
yeah, I absolutely get what you're saying. Yeah, don't like, yeah, come down to
Hmm.
their level so you're
Hmm.
not adding more to whatever's happening. And I
Absolutely.
liked what you said about consent, but I think it should happen right at the beginning of, like, even when I go to check on them the first time, like I come down to their
Yes.
level and be like, can I talk with you a little bit, or can I
Yes.
check in with you now? Even before you talk to them, right? Ooh, I
Ooh, I
lost you.
love that.
Yeah.
Yeah.
And then go into
Absolutely.
all the
Consent
things we're
from the
talking
very
about.
beginning. Because you're right.
Yeah.
Right. Right. Because
Hmm.
they may not want to be around anyone. And so,
Yeah.
okay,
I've had
have your
some people be
space.
like, nonverbal, leave me.
Yes,
Yeah.
exactly,
Yeah.
exactly. And then
Hmm.
do it, right?
Right.
Because
And
that's
then go
that's part
away.
of
Yeah.
consent, right? They have told
Exactly.
you what they want. Now do
Yeah.
it. Yeah,
Yeah.
leave them alone. Yeah.
Right.
Yeah,
Yeah.
for sure.
Hmm.
And I mean, it definitely is. It's a skill to
Hmm.
sit with discomfort with your own
Hmm.
and with other people's, right?
Yeah.
And especially,
Hmm.
I mean, I'm the same way. I want to help. I want you to feel better. But sometimes the way people feel better is feeling their feelings and doing what they
Yeah.
need to do, right?
Yeah. And it's not about fixing people. I think we sometimes have
Right.
this idea like you need to feel better. Like, maybe they
Right.
need to let that go. Maybe that's why they came here.
Yes.
Like.
Yes,
Yeah.
exactly.
Yeah.
Exactly.
Mhm.
Absolutely. So being a safe space for whatever emotions come up from any group
Mhm.
members, really, right?
Yes, definitely.
Yeah. Yeah,
Yeah.
absolutely. Absolutely. So those are some kind of, nonverbal tips
Mhm.
to, when you're facilitating a group. So let's talk a little bit more about some of the more verbal things. So
Yeah.
things to say and things never to say, right?
Oh, yes,
Equally
please.
important. Yes.
Yeah. Good.
Very important. Um, so options for things to say, and I can, I this is coming straight from the handout that I had put together for the thing that
Mhm.
Keely and I did when you guys were in
Okay.
Pennsylvania.
Yeah, the gathering.
So
Yeah, that's great.
yeah, so this can be, I
Mhm.
mean, you can use this, you can add it to whatever, because it's, basically a good list of to-dos and not to-dos, right? So
Wonderful. Yes, please.
some
Thank you.
options of what to say.
Hmm.
So, well, first I should ask, how much do you all go into like active listening skills, how to converse with people, that kind of thing?
Yeah, I do have a little module on
Oh,
active
perfect.
listening and deep listening. Yeah.
Hmm.
Um, I mean,
Okay,
it's
good.
not exhaustive. It's 5 paragraphs, but
Yeah, but it's something. That's good. Okay,
something. Yeah,
perfect.
it's there. Yep.
Perfect. Okay, good. So
Really
doing
important.
doing those skills of, you know,
Hmm.
letting people know that you're, and this is if you're choosing to engage with someone who's having a trauma response, obviously,
Right. Yeah.
right?
How to do the deep listening and the active listening to, right.
Exactly,
Reflective and
exactly.
all those kind of
Reflective,
tools.
yeah, yeah.
Hmm.
So offering that supportive reassurance through those
Hmm.
active listening skills, right? And then
Yeah.
other things that you can say. You're so brave for talking about this,
Hmm.
especially for people who have kept their trauma inside for so long
Hmm.
and they just start to like, even if it's just a little bit, like, I'm
Yeah.
having some flashbacks from something that happened when I was younger. I've never talked about it. You're so
Hmm.
brave for telling me. Like, that's a
Yeah.
huge strength. Like, highlight the
Hmm.
strengths of the person, right?
It is.
And then let's say,
Yeah.
they've experienced something and they're feeling another kind of emotional symptom of trauma is guilt and shame. So if they start
Hmm.
talking about whatever it is, it's not your fault, right? I'm
Yeah.
so sorry that happened to you.
Mm.
For survivors of domestic violence, sexual violence, I believe you. That's a big one because there's
Yes.
so much victim blaming in our culture. So letting
Mm-hmm.
them know that you believe them can be so supporting
Yeah.
and healing for them.
Yeah.
Saying something like, "Thank you for trusting me with this information." Because if they're expressing
Hmm.
it to you, they
Hmm.
trust you, and that's
Yeah.
big. So you've
That
done
is
you've
big.
done your job, right? Of
Yeah.
facilitating a safe environment if people
Hmm.
are, willing to start to talk to you about some of these situations, right?
Absolutely.
So
Yes.
if you know that, someone coming to the cuddle party has a history of trauma, you
Mm.
can ask, how might that affect you during the group? What do you need
Hmm.
during our group to be grounded and be okay, right? Not everyone
Yeah.
knows ahead of time, but
Hmm.
if you do, you can always,
Yeah.
say something like that, right?
Yeah. Something I like
Yeah.
to do if someone discloses to me, ahead of a group,
Hmm.
that they have a worry or, I'm dealing with this or whatever, I can
Yeah.
say, is there a signal that we can have? So, when I see like
Ooh.
your foot is popping, I will come over and check on you, you
Ooh,
know.
that's good.
Yeah, so they
Yeah.
can know that I'm there to back them up, right? And there's a way that
Yeah.
they can call me in without like letting everybody else know about it.
Right. Ooh, I love that because it can be very discreet too. Like they don't
Yeah.
have to raise their hand and be like, "Hey, I'm feeling
Hmm.
trauma," right? But like
Right.
maybe
I'm
they
like,
start scratching their
Santini.
nose
Yeah.
or like, yeah, whatever the signal is that,
Yeah.
the rest of the group isn't going to really notice, but because you guys have already talked about
Yeah,
that.
we talked
Like,
about it, and we can
oh, I
offer
love
them
that.
that kind of support if they will come to
Yes.
us before and tell us,
Right.
this something might happen, or, I know that
Right.
this might be activating for me, and then we can say, yeah, like you said,
Yeah.
what would you need, or what could I do
Yeah.
to help you? And do you want to have like a signal so that I can be helping to watch you
Yes.
more?
I love that. I might
Yeah,
steal that actually. That's
please
a
do.
really good.
Please
That is so
do.
good.
Yeah.
Yes. Yes. See, we learn
And
from each other. I love it.
we do, we do. And honestly, the people that I've done that with just felt like that was what they needed to feel safe, and they never called me
Yeah.
over. Like,
Exactly.
but they knew they could any moment,
Exactly.
right? So that gave them
Yeah.
permission to like really just be themselves
Yeah.
and feel safer.
Feel safe.
So
Oh, I love that. I love that so
yeah.
much. Yes. Yes.
Yay.
Yes. Very good.
Copyright Mary Sorensen. No, I'm kidding.
Yeah, right?
Please spread it. Use it,
Every
spread
time
it,
I use that,
everybody.
I'll give you $1.
That'd be great.
Yeah, right.
No, I just
Love
really
it.
want to help people. That's why I'm here.
That's right. That's right. I love it. I love it. So yeah, so supporting people's strengths. If let's say someone is, having a trauma reaction and they need to go off by themselves for a while, supporting
Mhm.
that. And like
Mhm.
saying, being genuine and saying, I'm really glad you took care of yourself when you needed
Yeah.
to. Because
Right.
again, that's reinforcing to people
Hmm.
that you are allowed to take care of yourself,
Hmm.
right?
And that is a good thing. What you're doing right now is
Yes.
good. Like you're telling me what you
Yes.
need. You're taking care
Yes.
of yourself. This is exactly what I want you to do, right?
Yeah, exactly.
Yeah.
Right.
Hmm.
Right.
Yeah. It's
Exactly.
like validating. Yeah, validating. That's the
Validating.
word. Yeah.
Right. Right. Empowering them to, you
Yes,
know, do what they need
exactly.
to do to take care of
Hmm.
themselves. Yeah. Yeah.
Yeah. Oh, and one more
And
thing before I
yeah.
forget that I like to
Yeah.
say is like I'm honored that you're
Ooh,
able to
yes.
do this in front of me or sharing this with me.
Yeah, absolutely. Because it's very powerful, right? For someone to feel safe enough to start to show and talk about some of their like deepest, darkest,
Mhm.
distressing things,
Yeah,
like that's a huge deal,
it
right?
is. It
So,
is. And I am
yeah,
honored. And
yeah,
I feel like a lot of
absolutely.
people maybe feel like I'm going to judge them for it badly. I'm like,
Right?
no, you're amazing. You know,
Yeah,
you're you're doing
exactly.
it. This is
You're
awesome.
doing it. Yeah, doing what
Yeah.
you're supposed to
Hmm.
do. Right,
Yeah,
right.
exactly. Hmm.
Yeah, yeah,
Yeah.
yeah. And then, focusing on their feelings kind of in the moment. So bringing them back to in the moment. Can you tell me how you're feeling? If they say, I'm just feeling, really sad, acknowledge that feeling, normalize that feeling. That's a big thing. Whatever the person is
Hmm.
feeling is okay, right?
Yes.
All the
People need to
feelings are
feel their
okay.
feelings. Yeah, we can never tell people
Yes.
like you shouldn't be feeling that or
Right.
no, people feel their feelings
Exactly.
and they need space to feel their feelings. Yeah, I agree.
Absolutely. Absolutely. Just a,
Hmm.
a a quick soapbox about feelings
Yeah. Okay.
because so many people, and this is again kind of a cultural thing, like there's good
Hmm.
feelings, joy, happiness, excitement, and there's bad feelings, anger,
Mm.
sadness, shame, blame. That is incorrect. There
I was
are
just
no
gonna
good or
say,
bad
I'm like, I'm
feelings.
pretty sure that's where Shelley's going, so I'm not gonna
Yep.
interrupt. But I'm like, feelings are feelings.
Feelings are
They're not good
feelings.
and bad. Yeah,
They
I
are
love
not,
it.
yes, they are not good or bad. They are
Yeah.
literally chemical reactions in your brain that you cannot
Hmm.
control.
Yeah.
And for some of these feelings, let's say anger, sadness, etc., it's
Hmm.
a barometer to tell
Hmm.
you how you are experiencing your environment or your past or your world, right?
Yeah.
So it's a signal of I'm
Hmm.
feeling sad. Okay, now I need to do this or whatever. I'm feeling happy, so I'm gonna like woohoo, hug the person if they want it, like whatever, right? So
Yeah.
there's
Well,
no good or bad feelings. There
yeah,
are
and
good or bad behaviors.
behaviors.
Behaviors
Yes.
are what's good or bad. So if I'm
Hmm.
angry and I say,
Hmm.
you know what, Mary, when you said this, that really
Hmm.
upset me, like that's good, right? We talk about it. If I'm
Yeah,
angry and I punch you in the face, that's
that's bad.
bad, right? But it's not the anger
Yeah.
that's bad, it's the
No. Right.
behavior that's bad, right?
Yes,
So that's an
exactly.
important distinction. I'm always all about like
Yeah.
honor our feelings. There's wisdom in our
Hmm.
feelings.
Yeah, and I know I said this already, but I just want to say it again. Like, we don't have to fix our feelings. If somebody's
Exactly.
sad, maybe that could be like amazing. That could be like really delicious. Like,
Yes.
let's be sad. There's a
Yeah.
reason to be sad. What
There's
you
a reason to be
like
sad.
if you don't
Yeah.
let yourself be sad, like when you want to be sad,
Right.
that's worse, right?
Absolutely.
Like we can wallow in the
Absolutely.
sad for a while, or even in the anger, like that can really like
Yeah.
feed you too.
Right.
And as you said, it's about the behavior.
Yep.
And I think it's also about the intent. Like maybe I
Yes.
don't want to be sad. And that's when I want to
Right.
try to change it. But like just being sad doesn't mean you
Right.
have to change it, right?
Exactly.
Exactly. Exactly.
Exactly. Sitting with the
Mhm.
distress of feeling the
Yeah,
feeling can be very healing.
it
And
can.
we're so good at shoving, right? I'm feeling a certain
Right.
way, gonna ignore it, shove it down, shove it down.
Hmm.
But
Hmm.
internal chaos creates external chaos. And that's then
Hmm.
when you maybe start to get behaviors that are not
Mhm.
so great because you've got so many feelings all shoved in there and you haven't given yourself the permission to feel them, right? Yeah.
Right. That's the real problem, I think, when people haven't
Mhm.
allowed themselves to feel their feelings, or they weren't
Yeah.
allowed because they had to keep going, or, other people in their life were like, why are you sad? Don't be
Exactly.
sad. Don't be sad. It's like, no, I need to be
Right.
sad sometimes. Like my dad
Exactly.
died. I'm gonna be sad.
Yes,
You know,
exactly.
this is
Exactly.
a reason to be sad, and I am sad, and it's
Yeah,
okay, and I need to be.
definitely.
Yeah.
Definitely.
Uh,
Yeah. Yeah,
yeah.
exactly. Exactly. Yeah, so that's kind of a good summary of things that you can do and say. So then let's
Mhm.
do the opposite, things you should not do or
Okay.
say, right?
Yeah.
So you already kind of touched on one is not
Hmm.
giving advice. The you
Hmm.
should do, right?
Hmm.
Or you will feel better if you do this.
Hmm.
My guess is you're not psychic. You don't know if that's true,
Right. Yeah. Everyone's
right?
different.
Like you
Yeah.
don't want to set people up with hope
Hmm.
if you don't know if
Hmm.
that's going to happen. So you'll feel better tomorrow. You don't know that. You don't know what's going on at their home. Like,
That's like, what is that called? Where it's like joyful optimism or something? Like that's
oh, the
just as
toxic
bad as negativity, right?
positivity.
Wait, say
Toxic
it again.
positivity.
That.
Yeah.
That's what I was
Yep.
thinking of. Yeah.
That is what that is. Yes.
Yes.
Yes. And it also negates the just
Hmm.
general benefits of feeling. Like,
Right. Hmm.
if you're feeling sad tomorrow, that's okay too. Yeah.
That might
Like,
be. I
you
have no
might need to
control
feel
over
sad for
tomorrow.
a while.
Like,
Yeah, exactly. Exactly. So,
yeah.
not giving advice.
Hmm.
We kind of already talked about this too, but not minimizing or challenging or invalidating their experience. So,
Hmm.
however they're feeling, whatever is causing it, is okay. You are still you know, a, a good person. Some people start to feel bad about themselves, especially in a group
Hmm.
setting, if they start to have
Hmm.
feelings because they're feeling like like everyone's looking at me now, everyone's judging
Hmm.
me, like I shouldn't be
Yeah.
feeling these things. No, it's okay, and it's actually good. It's
Hmm.
good that you're feeling these feelings and like showing people that it's okay to feel feelings and
Yeah.
do what they need to do
Hmm.
to support themselves, basically. Right?
Exactly.
Yeah. Yeah. And then not questioning their
Hmm.
choices. So this comes up if someone is kind of talking about either what they need in the moment or maybe what has
Hmm.
happened in the past and maybe they say like, I need to leave, right?
Hmm.
If that's what they feel that they need to do, if it's the group is too much for them right now, if they
Hmm.
know that they're gonna just feel worse, uh,
Hmm.
if they need to go, and I would make sure they have a supportive person to talk to, like who can you talk to on your way home or whatever.
Hmm.
But like they may feel that pressure from other participants, or other participants might be like, no, stay, right?
Hmm.
But again, part of consent is that is what this
Hmm.
person is asking for. That is what they
Right.
need. If they need to get up and
Yeah.
leave the group for the day,
Hmm.
that is okay, right? So
Yeah.
again, whatever people need in
Hmm.
those moments, aside from like, hey, I'm going to take this really nice statue of yours. Okay, yeah, that you can't, that may make you feel better. It'll make me feel worse. Like you can't steal from
Yeah.
me. That's not a coping
Hmm.
skill. But like,
Yeah.
good, healthy coping skills,
Right.
supporting those things
Yeah.
if that is what the person is choosing
Hmm.
to do, right?
Yeah. Hmm.
Yeah,
Definitely.
good. And then details. Okay. We are a curious species. And
Mm.
oftentimes, if people reveal that something bad has happened to them in their past, others
Mm.
want details. What happened?
Mm.
Who did that to you? What did you do
Mm.
after? Don't ask details. You
Mm.
don't need to know. Oftentimes,
Mm.
and like I said, I've worked with thousands of
Mm.
sexual abuse survivors. I don't know who the perpetrator is. I don't know where
Mhm.
the abuse happened. I don't need to know because what we're
Mhm.
dealing with is the feelings right now and how it's affecting
Right.
you right now, right?
Yeah.
So that past stuff, that's for a therapist to deal with if it comes to that, right? But even as a
Mhm.
therapist, I don't need to know all of those details, and it will
Yeah.
be more activating
Mm-hmm.
if that person is asked. And maybe some people want to talk about it, and that's fine.
Yeah.
But this is for that this may not be the space for that, right?
Yeah. Mm-hmm.
And the time. And it's
Mm-hmm.
also okay if people don't want to talk about. They just are expressing
Hmm.
that they are feeling some type of way right now,
Yeah.
you know. So we go with that, right? So
Yeah, absolutely. Yeah, in
yeah.
the moment, asking details just is not irrelevant. Like you said,
No,
there
no.
have been some situations where later, if there was a reason why, I
Hmm.
might say, do you want to share your story with me? Because
Sure.
I'd like to know.
Hmm.
And sometimes they do, and sometimes they don't, and that's
Yeah,
okay. You know.
exactly.
Hmm.
Offering that
Hmm.
later on when it is appropriate, when you
Later.
know you're going to be okay to hear whatever the information is.
Yeah.
Right? Yeah, absolutely.
Hmm.
Absolutely. The other kind of thing that's important to not do is
Mm.
to not make the person having the trauma response be responsible for your feelings.
Mm.
And this
Hmm.
goes into, in a little bit, I'm going to talk about like transference and countertransference. But if
Okay.
you are feeling triggered, then
Hmm.
you are the one that needs to like do what you need to do to be okay
Mm.
and not put that on the other person, right?
Yeah,
Because
like,
again,
oh
that's
my gosh,
invalidating.
you're having a response and now I'm all upset too. And I can't believe that you're doing this to me. And then now they have to try to come out of their response
Exactly.
and be like, it's okay, calm down. Yeah, that's
Right.
not cool. Yeah.
Not cool. That also
Mm-mm.
happens if,
Hmm.
as the facilitator,
Hmm.
people tend start to share too much about their own
Mm.
stuff, and so now
Yeah.
you're taking the what should be like the attention on this person. Now it's on you, and it's all about
Mm.
you. And we're
Hmm.
not talking about what do you need right now, right?
Right. Yeah.
So just noticing. And again, it's fine
Hmm.
if you're triggered. Like you can't help if you are feeling triggered
Right. We
or
still
if
need
you
to
are
feel our feelings.
feeling right,
Yeah.
anxious or overwhelmed by this person or what have you. Like that's okay.
Hmm.
But invalidating what they're feeling and their experience to make
Hmm.
yourself feel better is
Hmm.
inappropriate, basically,
Yeah.
right? Yeah.
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 Especially as the one in the helper role, like you were saying, like,
Exactly.
it's okay to feel your
Exactly.
feelings, but then you need to go take care of yourself if that's what you need to do, and not like just take it from
Yes.
the other person. Yeah.
Absolutely.
Hmm. Yeah.
Absolutely. Yeah. The other important thing, we kind of touched on this too, is to never promise anything.
Mm-hmm.
So, if the person decides, I'm gonna contact my therapist and, talk to them, maybe schedule a second session for the week because I'm really just feeling, you know, discombobulated, I'm really feeling anxious.
Hmm.
Not saying something like let's say the person calls their therapist and leaves a message, "Oh, I'm sure they'll get back to you today." As a therapist, I can tell you that's not
Not always.
necessarily true.
Yeah.
Most therapists have, a 24 to 48 like hour policy of getting back to
Yeah.
clients who call.
Hmm.
But if they're on vacation or it's a long weekend, that may not be the only option you need to think about for this
Hmm.
person. Maybe they have other support people that they can call
Hmm.
before and, get that support until their therapist calls. Again, with
Right.
the you'll feel better tomorrow. You don't know
Mm.
that, can't promise that, right?
Yep.
Yeah.
Oh, my favorite. God has a plan for you. It's all going to be
Ooh.
fine.
Oh,
It's
no,
all meant to
no,
be. Oh my
no.
gosh.
Oh, and
No.
maybe the person believes that, and that's fine.
Maybe that
But
might help that person if you know that they are religious, but yeah, I
right.
still would never
But
say that.
overall, yeah, that is not something, because again, now you're
Uh,
invalidating their trauma, that it's part of God's
mhm.
plan. And
Yeah.
yeah,
Mm.
yeah, God wants me
Mm.
to feel like crap. Fantastic.
Yeah.
Yeah, not something to go with for
Mm.
sure, for sure.
Yeah, plus, those of us who are not in that community,
Correct.
way more
Correct.
activating.
Oh my God. Now, yeah. And that's actually a really good point. I'm glad you brought that
Mhm.
up because so
Yeah.
many people have religious trauma. That is its
Yes.
own
Hmm.
specific set of trauma.
You're right. Yeah.
And now you just triggered that, right?
I was like, yeah,
So,
I needed that on top of what I was already
right.
experiencing. Thank you. Yeah.
Exactly. Exactly. Right. Right.
Yeah.
Yeah. So be careful with that.
Be careful. I
Um,
mean, with all the best intentions of the world, that might help you. It probably won't help a lot of other people.
no, exactly. Exactly. I absolutely agree.
Mhm.
Thank you for bringing
Yeah.
that up. That's
You're
good.
welcome.
Yeah. Yeah. We mentioned this already, but don't say or imply that their trauma is not traumatic or that they should not be feeling what they're feeling. They should be
Yeah.
over it. Anything like
Hmm.
that, right? Any kind of
Hmm.
invalidation is going to make things
Yeah.
worse.
Hmm.
Um, and then if you do not get details, don't assume anything because you don't know. Don't assume that, oh, well, this started to happen after, we did an activity that involved touch. And so they must have been sexually assaulted. You don't
Hmm.
know, right? And it doesn't matter
It
because
doesn't
whatever
matter.
they're feeling in that moment, it doesn't matter the details behind it. Like,
Hmm.
okay, how can we support you right now with
Hmm.
these feelings, right? Do you need to sit out of this particular
Hmm.
exercise or what have
Hmm.
you and just observe? And maybe that in and of itself could be healing to just watch and not
Hmm.
have to participate, right?
Yeah. And that kind
Yeah.
of brought me back to something you said earlier, but we went past
Mm.
it quickly because I know you're going to talk about it now.
Hmm.
But when you ask consent to come and talk to
Hmm.
people, a lot of the time, like my inclination might be like to put my hand on your shoulder or something and say, "Hey,
Yes.
how are you doing?
Yes.
I'm checking in on you." Like,
Yes.
but touching at all when somebody's in a state like that
Hmm.
might not be the right thing.
Absolutely.
So I'm
Absolutely.
thinking don't touch until after I say, hey, can I talk with you? Can I check in with you?
Correct.
Would you like a
Correct.
hug or would you like me to, hold
Yeah.
hands while we talk? That might be
Yeah.
the point where you could say maybe some physical
Yes.
contact.
Exactly.
Always consent
Exactly.
first, right?
Always consent for sure.
Hmm.
Exactly.
Yeah.
Absolutely. 100%. 100%. And
Hmm.
and I'm the same way. I'm a very touchy-feely person. I
Yeah.
like to hug everybody. But
Hmm.
if that's not always appropriate, especially if
Hmm.
someone is having a trauma response, because
Yeah.
that can just activate them more. Because if you think like their system is on hyper alert, right?
Hmm.
And it may
Yeah.
be confusing to them. They may have all sorts of feelings, but
Hmm.
ultimately their body is going to be more sensitive and more
Hmm.
activated by touch than normal because your whole system is, right?
Right.
So
Absolutely.
always asking permission. And
Hmm.
sometimes you can kind of tell like, oh, this person is not going to want to be touched. And some people you can kind of see them lean and like open their arms towards you that they're wanting a hug. I would still
Yeah.
ask like, is it okay if I hug you?
Yeah.
It looks like you're wanting a hug, right?
Hmm.
So,
Yeah.
yeah.
Hmm.
Yeah. Absolutely.
I like that.
Absolutely. So, let's talk a little bit about some grounding things. What can you do
Yes.
in these situations, should you
Hmm.
choose to, with someone who is more activated? So, I
Hmm.
mean, there are books written on this.
There are. I know.
So there's
Yeah.
lots, but I pulled
Hmm.
kind of my 8 favorites that I go to
Excellent. Hmm.
because not everybody, it's like some things are not going to work with everybody, right?
Hmm.
So having some tools in your toolbox to kind of pull out when
Hmm.
someone is activated to see like let's try this, right? Or how about
Hmm.
you do this while I finish this exercise with the rest of the group, right? So it's also
Hmm.
giving them something that they can do if they need to kind of be by themselves while you're doing your job, basically, right?
Right. Yeah.
So one of my favorites is the 5 4 3 2 1. Have you heard of 5 4 3 2 1? Yeah.
I have. Hmm. Yep.
Yeah.
I've used it. Yeah. That's great.
Perfect. Perfect.
Hmm.
So there's several manifestations of 5 4 3 2 1s, but
Hmm.
basically it's getting people to focus on their senses, which means they're
Hmm.
focusing here in the present moment, which is where we want them to, right?
Right.
So the one that I do is,
Hmm.
okay, tell me 5 things that you can see. I like to have people describe it in detail. So as opposed to saying like, I see a clock,
Hmm.
tell me a little more color,
Hmm.
size, like really
Hmm.
start to get them to give you more details because that helps focus and they'll
Focus.
notice that the
Yep.
anxiety usually or the feelings start to go
Hmm.
down, right?
Yeah.
So
Hmm.
5 things you can see,
Hmm.
4 things you can hear, 3 things you can touch, 2 things you can smell, And then number one, depending on what's going on, number one thing you can taste, or oftentimes people aren't eating,
Mhm.
and so they have nothing to taste. So I'll
Mhm.
say, name one of your strengths. So
Oh.
then it refocuses them onto
Mhm.
their here and now, themselves, something
Mhm.
positive, right?
Mhm.
To combat maybe some of the negative cognitions that are being triggered in their head. So five things you can
Nice.
see, four things you can hear, three things you can touch, two things you can smell, and either one thing you can taste or name a strength that you have.
Mhm.
So that's
Okay.
one of my favorites. That's kind of my
Yes.
go-to, like right off the bat.
Yeah, that just really
So,
brings them into the space of
oh
like
yeah.
now
Mm-hmm.
instead of in the past, right?
Mm-hmm.
Yeah.
Exactly, exactly. Another thing that you can do, which is a good activity for everybody, is body scans. So
Hmm.
focusing on different parts of your body. Now, the trick with that, sometimes you have to be a little careful because if someone really feels their trauma in their body, feeling
Hmm.
their body might increase the trauma.
Mm,
Right.
yeah.
So,
Okay.
so with body scans, sometimes they work better if they're shorter for someone who is
Hmm.
more activated. So,
Hmm.
1 to 5 minutes.
Hmm.
But doing a body scan is a good thing because it does focus on the here and now. Like
Hmm.
I am right now, and you can even sit
Hmm.
with them and say, right now in this moment, you are safe, right? Which is
Hmm.
true, right? Because you are
Yeah.
safe with this person.
Hmm.
And oftentimes, when people are thrown into being triggered with trauma, their body, their mind is thinking, we are not safe right now, right?
Hmm.
Reminding
Yeah.
them, you're safe. You're
Hmm.
here in my living room or wherever they are, my office, whatever. Like you're sitting on a comfortable chair. Notice that chair. Like, what does that feel under when you're sitting? What does that feel like?
Hmm.
Having your feet on the floor. What does the ground feel like under your feet?
Okay.
Right.
Yeah,
So
that's not what I
doing
was thinking
more,
of for a body scan.
right,
Um,
right. Body
yeah,
scans typically are like you start at the head and you go down to your
like
feet
it's
and you
like a
notice.
meditation where you're trying to relax your body,
Exactly.
usually is what I've seen. Is that,
Exactly.
oh, that
That's
is what you're talking
correct.
about.
That is
Okay.
correct. Yes. So you can do that kind of body scan. If that is too activating for a person,
Hmm.
then
Hmm.
doing like the piecemeal kinds of things. So like, you know,
Hmm.
how about, you go outside and stand in the grass in your bare feet and like feel what that feels like, right?
Okay.
Or you're sitting
Hmm.
on this couch. Tell me what does that feel like under your seat or as your
Okay.
hands are resting on the armrests? What does that feel
Hmm.
like, right? So
Yeah.
doing
Okay.
things or, noticing a lot of times stress people, their shoulders start to go up. Like,
Hmm.
let's just notice your shoulders. Maybe do some shoulder rolls. See if we
Hmm.
can't relax those shoulders. Jaw tense is
Oh,
another big
always.
one. So
Yeah.
having people open and close their mouth and
Hmm.
then relaxing. So there's also, it's called progressive relaxation. So it's tensing, 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 and then releasing and feeling the release.
Okay.
So there's exercises that there's all sorts of scripts for them online, right? You can
Yeah.
find, but just
Hmm.
doing these things again, it's bringing them into the moment, right?
Bringing them into the body. Yeah.
Bringing them into the body.
Hmm.
Going along with that, another one of my favorites is let's go outside. Now, obviously, if you are a facilitator, you may not be able to do this because you may not
Hmm.
be able to leave your group, but this could be
Yeah.
something for afterwards. Like, hey, while you're
Hmm.
waiting on your ride, let's just go spend 5 minutes outside and notice
Hmm.
the fresh air, right? You can
Hmm.
then even do 5, 4, 3, 2, 1 outside because it's going to be different, right?
Right. Yeah.
So, and then, or, doing some body scans, like notice if you're
Hmm.
feeling any tension, like do we need to kind of
Hmm.
wiggle our arms a little bit or
Hmm.
dance around? Like, what do we need to do to kind of loosen up, right?
Yeah.
So,
Hmm.
but being outside in general, being in nature in general, like putting your hand on a tree, there's something about nature that is
There is.
very therapeutic and very
Hmm.
grounding, literally Mother Earth grounding, right? So
Absolutely.
if you're able to, again, not everyone is able
Yeah.
to, other people bring the outside inside. So,
Hmm.
do you want to go sit in the chair that's by my plants?
Hmm.
Or
Hmm.
obviously, if the person isn't allergic or scared, like, do you want to pet one of my cats? Like these
Hmm.
kinds of things that are, again, grounding, but if it's because we live in Chicago, if it's 20 below outside and there's 3 feet of snow on the ground, I mean, that is in and of itself actually something you can do is go out in the snow, but not
Yeah.
everyone will want to do
Not everyone will want that. Yeah.
that. No, no,
Could
exactly.
be refreshing.
Could be refreshing, right? So having things in your space. Some people have plants, some
Hmm.
people have an animal. I usually have a lot of rocks and crystals around because I am just that kind of person. Yeah. Oh, yes, rose quartz. It's for the heart. Oh yeah,
Yes.
very good. This one's my smoky quartz.
I love it.
It absorbs negative energy. So
Oh,
so
great.
having
Yeah.
having something in your hand, right? A
That they
lot of
can
people
just kind
keep
of hold on to.
hold
Yeah.
it. Yeah, those
Hmm.
smooth river rocks, you can get those super cheap
Hmm.
at craft
Hmm.
stores. Have a bowl of them if people need to take one and just
Hmm.
kind of in their pocket
Yeah.
or in their
Just.
hand, just feel it, right?
Hmm.
So this connection to things that
Yeah.
are in our natural world.
Hmm.
And I mean, the
Yeah.
same kind of thing is, fidgets. So that's
Yeah.
actually
That's
the
what I was just
next
gonna
one.
say. It's kind of, I mean, I'm using this as a fidget right now.
It's
So
basic,
yeah.
yeah, it's basically a fidget. Right,
Yeah. But
exactly,
I love that it's
exactly.
a natural thing. So
Yes.
yeah.
Yes,
Yeah.
exactly.
Hmm.
Exactly. Perfect.
Yeah.
So
That's
then
great.
next one would be breathing. So oftentimes when people are
Mm-hmm.
triggered, their breathing gets very shallow, which
Mm-hmm.
then increases the likelihood of increased distress because when we breathe
Hmm.
shallow, there's not enough oxygen going to our brain, so our brain thinks there's something wrong. So then
Right.
now we're more activated, right?
Hmm.
So purposefully, and it doesn't have to be like a 5 minute breathing meditation. My
Hmm.
favorite one, especially if people are having panic attacks, is
Hmm.
sitting up nice and straight
Hmm.
and then breathe in through your nose and breathe as though you are making the breath go down into your belly. So full lung capacity here. So breathing in through your nose, hold it, hold it, hold it out through your mouth. So it's a deep breath in, hold it, hold it, hold it, and so it's a 3 second hold. And the
Hmm.
more people do it, the more they'll actually start to
Hmm.
just generally breathe that way and get the
Right.
oxygen that they need. They'll notice anxiety
Hmm.
starts to go down, panic attack symptoms
Yeah.
start to go down.
Hmm.
They're more in the present, right? And
Hmm.
they can do that for as long as they need to, right? So
Yeah.
you sit here, do that, and I'm going to come
Hmm.
back and check on you if that's okay in a couple minutes, see where
Yeah.
you're at, right? So
Exactly.
breathing, getting them oxygen to their brain is
Oxygen
excellent.
to the brain is a good thing.
Yes, we
Yes.
all need oxygen to our brains.
Don't we? Yeah.
Mhm.
And as a
For
singer,
sure.
like just being reminded to do the diaphragm breathing is just important
Yes.
because even though I am a singer and it is pretty natural for me to
Right.
breathe down here. Like,
Yeah.
I just realized doing this, I haven't probably had a deep breath in quite a while. I'm sitting here breathing pretty shallowly.
Yes.
So,
Yes,
yeah.
exactly. Exactly. I mean, you are trained to be able to
Hmm.
breathe deeply, right? As
Yeah.
are
Yeah.
certain people, let's say if they're
Hmm.
singers, actors, what have
Hmm.
play instruments, like you're
Right.
trained to have those deep
Get that
breathing, that
deep,
that
yeah,
diaphragm
belly
breathing,
breath. Yeah.
belly breaths, right? In yoga, a lot of yoga practitioners just naturally do that because that's what they're
Hmm.
trained to do, right? But
Yeah.
even still in
Even still.
activating situations, like you just said, you noticed,
Mhm.
I haven't taken a deep breath in a while. Like,
Yeah.
yeah,
Exactly.
yeah, totally. That can
Yeah.
also happen, which is an interesting kind of move. It shows how the body is so involved in
Mm-hmm.
our emotional state, right? So
Hmm.
sometimes when people are concentrating really hard, they forget to breathe or they breathe
Yeah.
more shallow, right? Which
Right.
then signals to your brain something bad is going on, which then can
Mm-hmm.
now we're having a trauma response. And all it was is they were trying to concentrate on reading this page or whatever, right?
Right. Yeah.
So for people who are prone to that, and it's funny because I'm one of those people and I ride horses. And so back in the day when I would, be jumping a course around, my instructor
Mm-hmm.
would have me sing because it would force me to breathe
Breathe. Ah,
while I'm doing whatever I'm doing. Because by the
okay.
end of, jumping 10 jumps, like I, oh my gosh, it feels
Great.
like I ran 80 miles. I'm noticing my anxiety is up. I'm noticing some
Yeah.
panic symptoms. It has nothing to do because for me, horses are is a very relaxing spiritual activity.
Mhm.
But even still, like my body was like, oh, you're not getting enough oxygen, we might die.
Yeah.
Right? So being
Okay.
able to breathe, make yourself breathe, right? And that's
Yeah.
true for, the leaders of the groups as well. You're so
Hmm.
focused on everything that you're having to
Absolutely.
do.
Hmm.
Give yourself the gift of oxygen, right?
Yes, please.
Oh, okay,
Yeah.
that feels better, right?
Yeah. Yeah.
Yeah. And
When I
sometimes
liked
even
what
in,
you just
oh, go ahead. Yeah.
so I was gonna say I liked what you just said about like to get yourself out of that, you were singing.
Mm-hmm.
And I sometimes suggest to people, do you want to sing a song together or can I sing a song for you? You know, because that
Yes.
it gets you breathing, right?
Yes, exactly,
Yeah.
exactly.
Hmm.
And it's something that's so simple, like breathing,
Yeah.
right? And
Yeah.
yet can create so many issues.
Mm,
And, again, like as a practitioner, like, oh, I'm noticing just some tension within myself. Let's all just take a deep breath real quick. And
absolutely.
everybody does it,
Yeah,
right?
everybody.
Right.
Yeah, that's I actually have that as a little lesson earlier in the
Oh,
thing. Like if you're
good.
feeling kind of activated or if you feel like the whole group is kind of activated,
Mhm.
let's do a breath reset. Like just take a deep breath
Yeah.
with the
Yeah.
whole group. That helps you calm down. It helps bring the
Exactly.
group together. It gives us a moment, and I like to do it three
Yeah.
times.
Oh
Um,
yes,
yeah.
absolutely.
So
Yeah. Yeah. Get
yeah.
some good oxygen for not just
Hmm.
you, but for everybody
For
too,
everybody.
right? For
Yeah. Sometimes you
everybody.
can tell like the room is just
Yeah.
kind of scattered or activated. And it's
Right.
like
Right.
someone is having a big response and they go off and well, now I have the whole group is just kind of, let's
Right.
all breathe, you
Right.
guys.
Exactly.
Somebody shared something
Exactly.
super heavy
Yeah. Let's just take
and
a breath for a
yeah,
second.
just be like, okay,
Yeah.
okay, let's just take a deep breath. Yeah.
Yeah. Oh, I love that. I love that. And it's a nice quick little reset, right? That
Hmm.
everyone can
Yep.
do. And even people who aren't feeling activated, like oxygen isn't going to hurt anyone.
Right. It's
So,
not gonna hurt anybody.
right. It's a good thing. It's a
Exactly.
good thing. Yeah.
Hmm.
Yeah. So then another kind of this
Hmm.
is a simple kind of quick one. It's kind of a combination of the 5 4 3 2 1, just one area of it,
Hmm.
and kind of noticing your body, but giving them something to hold. So whether it's a
Hmm.
crystal or a rock, and describe every aspect of it. Notice it in your
Hmm.
hands as you feel it. What does it
Hmm.
feel like? So my rock on the top is really smooth. On the bottom,
Hmm.
it's kind of rough because it's uncut
Hmm.
on the bottom. It's
Yeah.
shiny, it's gray and white. There's a
Mhm.
point, 2 points. So having them really go through and describe to
Really
you
describe what they're feeling.
what they're feeling exactly.
Betty Martin does a really good exercise for this, and she calls it waking up
Mm.
the hands. Picking
Ooh,
an object and just like really like
yeah.
feeling it.
Really, yes,
Yeah,
exactly.
yeah.
I love that. I love that.
Letting, it feels different in my palm
Yeah.
than it does on my fingers, all of that. Yeah,
Yes,
yeah.
exactly,
Hmm.
exactly. Could do the same with a fidget toy.
Hmm.
I'm the type of neurodivergent pe people that I like soft things.
Oh,
So I
yeah,
keep
yeah.
this is a little like makeup cloth for people,
Oh, yeah.
and it's super soft. So I just keep it
Hmm.
here on my lap, and every so often
Hmm.
I touch it,
You can just
and
kind of pet it. Yeah.
yeah, kind of pet it. People do the same with,
Nice.
stuffed animals or whatever, like
Yeah.
whatever is needed to kind of like
Hmm.
here's something. Let's talk about how
Yeah.
it feels in your hand, the
Yeah, again,
temperature of it, whatever.
yeah, bringing your mind into your
Yeah,
senses of the current moment. Yeah.
exactly.
Oh, I
Exactly.
love that.
Yeah, yeah. So another
Mhm.
another little tip. Similarly,
Mhm.
using cold water. So giving them cold water to drink. If someone is really, really activated, splashing some cold water on their face.
Mhm.
If someone is really, really, really activated, having them hold an ice cube until it melts. Got to be careful with that one because that one hurts.
That could hurt. Yeah.
But all of
And make
these
a mess.
things can bring someone out of especially panic attacks, but trauma
Mm,
responses. And it's
okay.
based off of research from, I'm sure you've heard of stories where someone falls through the ice in a frozen lake and they're under there for hours and they
Hmm.
survive
Yeah.
because the body like shuts down certain parts of itself to
Hmm.
be able to it basically resets, right? So holding
Hmm.
an ice cube in your hand, splashing cold water on your face, it
Wow.
creates that same biological reaction to
Hmm.
shift how you are feeling. So for people
That's
who are
cool.
really, really
Hmm.
struggling, like we're talking full-blown panic
Hmm.
attacks, full-blown flashbacks, like
Mm.
is it okay if I get you a piece of ice to hold in your hand? And we're just going to sit
Wish.
here and let it melt and
Hmm.
breathe, right? So
Hmm.
things like that, obviously, like
Hmm.
again, with permission, because these are some of the more extreme
Hmm.
coping skills, right, to suggest
Hmm.
to somebody.
Yeah.
But it does reset them for a lot of people, especially if some
Hmm.
of these other things don't work as well,
Hmm.
then doing something like that with cold. So, like, in Chicago, like,
Hmm.
let's go out and stand in the snow and make a snowball, right? And
Yeah.
then, like, you can throw it at me if you want, like, what,
Yeah.
whatever.
Yeah. I wish I'd had that.
So,
I have been around a couple panic attacks.
yeah,
And
yeah,
it's hard. It's like, I don't know
it's
what to
hard.
do with this. You know, I'm here for
Yeah,
you. I'm trying to calm them down. But yeah, it's like,
yes. Panic
yeah.
attacks are tough. Deep breathing is really good for
Mhm.
panic attacks.
That's what I did. And
Yep.
I mean, eventually you come out of it. You can't sustain it. I
Right.
mean, you're gonna die or you'll
Right.
come out of it, right?
Right. Right. Exactly. Exactly. Eventually they
Yeah, I
come out
mean,
of
it's
it.
not funny, but I just laugh, but that's my
Yeah.
response to things. So,
Yeah, sure,
you know,
absolutely,
yeah.
absolutely. So yeah,
Yeah.
so doing something with cold can
But
help
having
some of
ice, I
those
love that
stubborn.
example. I love that
Yeah,
idea. Yeah.
yeah, yeah. So
Hmm.
so doing that, and then kind of a last one, and this would be for somebody who is able to regulate themselves fairly well. So not for
Hmm.
someone who is having a panic attack, because they're probably not going to
Hmm.
be able to do this, but
Hmm.
visualizing yourself in a calm, safe space. So maybe
Hmm.
they have their own like kind of go-to
Yeah.
space. I'm picturing myself all warm and cozy in my bed, or I'm
Mm-hmm.
picturing myself, snuggling with my dog, or whatever it
Hmm.
is, right? Go to that
Yeah.
safe space. Now, I say space because it can be anything. People like maybe people are like, I don't have any safe space that I can think of. Let's make one up, right?
Yeah, let's find one. Yeah.
So,
Yeah.
yeah, it can be whatever you want it to
Hmm.
be. I have a client, and this is a true thing. Her safe space is a field of cupcakes. Fantastic.
That's
If that
cool.
works for you, that's great. That's great because there
I'm
literally are
thinking of the
people
moon
who,
base.
yeah, like there are people who literally have no safe space on this earth, or they don't feel safe
Mm-hmm.
within their own body because they're having all
Yeah.
of these symptoms, these reactions, right?
Mm-hmm.
So being able to picture something, and it could be completely fantastical,
Hmm.
throw some Lord of the Rings characters, a dragon,
Yeah.
like a nice little warm
Wherever you
cottage,
can
like
feel safe. Yeah.
whatever, the beach, whatever, right? So, but
Hmm.
that is for someone who can go to that space in their mind and
Hmm.
not continually be triggered, which will then take them out of that space. So that's a
Right.
little bit more for someone who's a little bit more regulated,
Yeah.
right?
Yeah. Good.
So those are some go-to grounding
That's
exercises,
awesome.
go-to mindfulness exercises. If
I have,
people need more, it's really easy to Google.
yeah, I'm sure there's so many things to Google. Have you ever used tapping?
Ah, tapping.
That's like,
So yes, the
ever,
yep, if you are
I don't know
trained in
what they
that,
do.
and I was like a long time
Hmm.
ago, but I've
Yeah.
forgotten it. But yes, for people who are trained in that kind of
People who
tapping,
know how to use it. Yeah.
absolutely. Yes. Yes,
Well,
yes,
it's not really a
yes.
thing you can really do wrong, honestly. I mean,
You really can't because you're
yeah.
not, yeah. I mean, if like the tapping we use in EMDR is different than that kind of
Hmm. Hmm.
emotional, is it
Hmm.
EFT, emotional focus therapy? Something like that, it's called.
Yeah, it's
But
EFT, right? Yeah.
yeah, I think it's EFT.
So many
Yeah,
different
so
things.
you can look up EFT and like
Hmm.
yeah, there's like certain
Yeah.
places that you
Yeah,
tap
there's spots that you're supposed
spots,
to,
right? And
yeah.
that's what I can't remember. So yeah,
Yeah,
so
I
if you
know.
look it up, and there's also trainings on EFT that
Hmm.
are,
Yeah.
good as well to like learn how to do that, which that also, because you're tapping
Mhm.
on the different nerves, because the
Meridians
vagus
and
nerve is the main nerve
yeah.
that is like, woo,
Hmm.
right? So
Hmm.
tapping on some of these places
Hmm.
helps that nerve kind of settle
Yeah.
down a little bit.
Yeah.
Yep. Yep,
Could help.
exactly. Yeah,
So yeah,
yeah.
please, if anybody listening, if you're interested, go look up tapping because
Go,
we are not
yeah.
experts.
We no, not for that kind of tapping. Nope, nope.
Yeah.
So yeah, so then I want
Mm-hmm.
to mention a little bit. We've kind of touched on it, but
Mm-hmm.
countertransference, which is a thing for all of us in the helping profession, no matter what you do.
Mm-hmm.
So there's transference and there's countertransference. So transference is clients having certain feelings about you. This is where we get like clients have crushes on us, that kind of thing. That's transference, right?
Mm-hmm. Okay.
Countertransference is how we feel based on the client. So are we triggered? Are we
Mm.
having, God forbid, romantic feelings about our clients? Please don't. Um, like
Yeah.
how are we in relation to what this person
Mm-hmm.
is feeling, right? So for
Mm-hmm.
instance, if someone has grown up in a, let's say, a verbally abusive home environment, right? And so
Mm-hmm.
you're running a group and someone in that group is mentioning their experience of growing up in a verbally abusive environment, and maybe they say, oh, my dad used to say this to me or whatever, and maybe you
Mm-hmm.
notice, now my jaw is kind of clenching a little bit because I've
Mm-hmm.
experienced this too. And I'm not breathing as deeply as I should. I'm starting to feel some of that activation because, like,
Mm-hmm.
I still have some unresolved feelings from my
Mm-hmm.
own issues, right? So,
Mm-hmm.
knowing what your triggers are or
Mm-hmm.
how it feels in your body when you start to
Mm-hmm.
get triggered, right? So, kind of think of it as like a stoplight, right? So green, I'm grounded, I'm settled, I'm feeling good, I'm regulated, I
Mm-hmm.
can facilitate this group, right? Yellow is I'm noticing some things about
Mm-hmm.
myself, right? Like the jaw clenching, or my
Mm-hmm.
shoulders are up to my ears,
Yeah.
right? My back is hurting, my stomach is a little upset. I'm having
Mm-hmm.
these memories from back when I had a similar experience, right? So you
Yeah.
want to take care of yourself when you're in that yellow zone, because when you get to the red zone, that's when we start to think about panic attacks, flashbacks,
Mm-hmm.
things like that that are going to be really, really bad for you if you're trying to facilitate a group, right? And
Mm-hmm.
that's not to say that it's bad if something like that happens, because we can't control how our body reacts to trauma. But if you're
Mm-hmm.
able to notice that you're starting to get dysregulated,
Mm-hmm.
making sure you're breathing deeply or getting yourself a drink of water or having something that's comforting by you or
Mm-hmm.
whatever the case may be, so that you can get back into the green zone to continue to facilitate this group, right? So
Correct.
being on top of your own mental health needs and self-care
Mm-hmm.
requirements, basically,
Mm-hmm.
right?
Yeah,
Whatever that
and
looks like.
and we do recommend, like, if you are feeling that way, if you feel like it's affecting your
Hmm.
facilitation, it's okay to just say that.
Yeah.
Guys, I'm feeling kind of activated, but I'm ready to move
Yeah.
on. And I know you
Yeah.
might see that in me a little bit, but I just want to keep going and
Love that.
let's go. You know?
Yes. And that's part of genuineness. Again,
Hmm.
like
It is.
your nonverbals are going to tell a lot more about you. And if you are authentic with people, like
Hmm.
if someone notices, are you okay? And you're like,
Yeah.
yeah, I'm good, but you're not good,
It's like they know you're not good.
they know you're not good, right?
Yeah.
And it's okay. It's okay to not be good. Just
It's
don't lie
okay.
about
Yeah.
it. Like,
Hmm.
be authentic. And what you said is perfect. You don't have to go into details.
You don't have to say
Like,
why or
yeah,
whatever.
just, and
Yeah.
all of us, sometimes something
Hmm.
may happen during the group. Sometimes you come
Hmm.
into the group because things have happened in your life that,
Hmm.
I'm just feeling a little more irritable than usual. I don't have as much patience. I'm feeling a little more
Hmm.
anxious, like whatever it is,
Hmm.
acknowledging that. And sometimes just the act, and this is true for everyone, the act of acknowledging it makes it
Hmm.
the distress decrease, because you're
Yes.
giving
Thank you for
words,
saying
you're
that.
giving
Yeah.
voice to it. Yeah.
Right.
Yeah.
Yeah.
Yeah. And it's a good model for the people in your group too, to be authentic with
Right.
themselves and how they're feeling during the
Hmm.
time, right?
Absolutely.
So, and then lastly, so we have this thing called, countertransference. Here you are doing these groups, and I'm sure lots of stuff comes up because you're holding space for however many
Hmm.
individuals that are sitting here attending this group, right?
Hmm.
And so over time, if you are not taking care of yourself and however that looks like, over time, the stress of other people's stuff can affect us, right?
Mm, yes.
Especially trauma,
Hmm.
especially trauma. So one of
Hmm.
my favorite quotes that I sadly can't remember the author to, but he says that if you're exposed to trauma on a regular basis and you think it's not going to affect you, that's like thinking you can walk through water and not get wet. It
Hmm.
will happen, right?
Yeah.
But you
Hmm.
can mitigate the effects of it by taking care of yourself and
Hmm.
implementing, however that looks. Maybe before the group and after the group, you need to have, just some time to kind of like process what your
Hmm.
own stuff is or how the group went, or making sure
Yeah.
that you are not working constantly. Because some of us who
Hmm.
like to work all the time, that is not good for self-care, right?
Right.
So
Yeah.
whatever your self-care looks
Hmm.
like is important,
Hmm.
because what can happen is over time you can start to get burnt out. And
Hmm.
burnout can lead to something called compassion fatigue, which can lead to something called vicarious trauma. And
Hmm.
I'm not going to get into all of those right now because that's
Hmm.
more for, advanced kinds of
Yeah.
things. But compassion, and we've all experienced burnout. I'll start with that. We've all
Hmm.
experienced burnout. You need a weekend, you have a weekend, okay, feeling a lot better. You need a vacation, you take a vacation,
Hmm.
you come back to work and you feel better, right?
Hmm.
As opposed to vicarious trauma, where you do all the things that you're supposed to do to
Hmm.
take care of yourself and it doesn't fix it because you
Mm.
are now changed as a person based upon other people's stuff. And
Mm.
I'm not going to get into that too deeply, but for those
Yeah.
people who are around, you know, and it doesn't necessarily have to be trauma, it can just be mental health issues, people with
Hmm.
anxiety, depression. It's going to affect you. And if you don't take care of yourself, now it's a
Hmm.
chronic issue, like any medical
Yep.
condition, because mental health is also medical, right?
Hmm.
So, and there's books, and I have a couple of resources too about vicarious trauma for people who want to read more. And then
Excellent.
compassion fatigue basically is just that. You have become the
Mm.
empathetic person to an apathetic person. You are
Mm-hmm.
indifferent to other people's problems. Indifferent, and
Mm.
I feel like this is happening a lot with all the political in our
Hmm.
country. Like there's so much that
Yeah.
our minds are like, I got to take a step back. I cannot care about these things anymore because I will self-destruct, which then leads
Yes.
to vicarious trauma, right? So
Mm-hmm.
just noticing these things about
Hmm.
yourself as you're going about and becoming this amazing, cuddle party practitioner, and you're doing all these wonderful things to care for other people. We can't forget
Hmm.
about ourselves because
Correct.
you cannot do what you do if you are not okay, right?
Absolutely.
So being okay. And
Yes.
and maybe that means, let's say someone does have a person who has a really, really extreme trauma reaction or a really bad panic attack,
Mm.
and you do the best you can, but afterwards you're like, I don't know if I did that okay. Like, it's okay to talk to someone about it, right?
Hmm.
Talk to other practitioners who have been doing it longer. Um,
Hmm.
you can feel free to share my info. I am all about doing
Thank
consultations with
you.
people who are like, I just got to talk this out. Like, how can I do
Mm.
this better in the past? Or
In the
this person was
future.
having this or in the future, thank you, in the future, or this person had this reaction and it brought up all of my stuff and I don't know what to
Mm.
do with it, right? I am
Mm-hmm.
here to talk to you about that.
Oh, thank you,
Yes.
Shelley. You're
Of
amazing.
course, of course. Like I care so much about those in the helping profession because it's
Hmm.
such a privilege to be able
Mm.
to help other people that I
Hmm.
want those of us who are doing it to be okay and not to be
Mm.
creating more damage because of our own stuff, right? And it's no
Right.
shame that like our own stuff comes. I've been doing this over 15 years. I still get triggered with stuff.
Oh,
Like
yeah.
especially when it comes to like children or animals, like those are my big
Hmm.
like issues. Like those are the things I'm
Hmm.
going to take home with me, right? But
Hmm.
like then what do you do, right? I have my own therapist.
Right.
Everyone should
Good.
have a therapist, says the therapist. I have my own self-care routines. I have my support people, right? So
Mm-hmm.
making sure that you're taking care of yourself, whatever that looks like. So
Mm-hmm. Absolutely. We have
yeah.
a whole
So
module on self-care. So
good,
yeah.
good, 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 good.
Yeah.
And then I mean I have some books here for people who want more.
Hmm.
And then I also have others that I can send to you for people who, are interested in
Yes.
delving a little deeper. So Peter Levine, if you are a
Hmm.
Peter Levine fan, Waking the Tiger, which I do not have here in my hand, but is kind of his most famous work.
Hmm.
And he's all about how the body releases trauma. So
Hmm.
trauma and memory is one, and an unspoken voice is another good one. But his most easily accessible, the one people always think about when you say Peter Levine, is Waking the Tiger. That's a
Okay.
great one for people.
Hmm.
Um, then we have specifically, now this I will say is specifically for people who identify as female. And the reason that is, so this book is called Burnout: The Secret to Unlocking the Stress Cycle by Emily Nagoski. She goes into the stressors that are specific to being a female in this culture as
Hmm.
part of kind of the added on top of what we already deal with on a day-to-day life as far as work or whatever. So this one is
Hmm.
much more female gender focused, just FYI to people.
Hmm.
And then we have this one here. This is Overcoming Compassion Fatigue. It's actually a workbook, which I
Nice.
like. Um,
Hmm.
it's a practical resilience workbook by Martha Teeter and John Ludgate. So
Okay.
these will be on the list that I send you. I also have a list of others that I
Yay.
is some they're somewhere in my basement, so I couldn't find them at this moment, but I have them. This is what happens when you have too
Okay.
many books. Um, so yeah,
No
so
such thing.
I know, right? That is not a thing. There's no such thing as too many books.
No such thing.
No such thing. So
Uh,
yeah, so reading more on this topic, and
hmm.
then eventually, if we want to do a more advanced trauma training, we could do
Hmm.
that. But I think the books I'll send you are good, kind of beginner level, basic. They're accessible. They're
Perfect.
not like super academic where you're going to be like
Hmm.
falling asleep or not understanding, because there are
Yeah.
some books like that if people want them.
Hmm.
But we want
Yeah.
we want you to be able to actually understand the info.
Yeah, this is great, Shelley. Yeah, this is an
Yeah.
introduction. People listening,
Yeah.
if
Yeah.
you're interested in any little bit that we talked about, you can find libraries on every bit of it,
Oh my
right? So
gosh.
please
Yes.
do.
Yes. Please,
Yeah.
if you want to
Yeah.
contact me and be like,
Hmm.
Tell me more about this," or "I didn't
Hmm.
quite understand this," like feel free. I can talk about this forever.
I know. I feel like I can too. I mean, I love geeking out on this
Yeah.
stuff. So
I know, right?
yeah.
Totally, totally. So
And
yeah, so
unfortunately,
that's what I've
yeah,
got.
I was gonna say our time is about
My
up for
time is up,
today. So
which is perfect because that is the
yeah.
end of my outline. So,
Oh, perfect.
woo,
What a
yay.
great conversation, Shelley. I love this. This
Yeah.
has been wonderful. And
Good, good,
yeah,
good.
lots
Yeah,
of good info, I think.
good. I'm so glad. I'm so glad. And
Yeah.
like I said, anyone can contact me at any time.
Mhm.
So I'll, give you my contact info that you can put in everything.
Yeah.
I'll have these books as resources. I'll
Hmm.
have some other resources too, as far as like websites and stuff if people want to go to. So yeah.
Perfect. Thank you so
Yes.
much.
You are
Thank you
so
so much.
welcome. You
Yes.
are so, so welcome. Yes. And thank you to everyone listening who just heard me
Hmm.
drone on for an hour and a half about all sorts of random things. But,
Not
hopefully
random at all.
you took a little bit of wisdom from it, hopefully, to use when
Hopefully.
you are facilitating. So,
Yes, absolutely.
yeah,
All right.
yeah.
Well, I'm going to say goodbye to our listeners. Thanks, you guys.
Thanks.